she and Aileen are research specialists at the Institute. And Lindsay actually worked with us at the second Building Bridges Conference. That's where we met Lindsay. She was a CCSU student in the Criminology and Criminal Justice program, and has really blossomed under now working as a research specialist, and we're really happy to have her. She's an extremely smart, capable person, and one of those people that we talk about when we're saying CCSU graduates, they come back to Connecticut, they stay in Connecticut, and they help participate in the workforce and in public policy in the future, and she's doing a great job with that. And she's now getting her master's degree here at Central, and she'll introduce the next panel.
As Andrew mentioned, my name is Lindsay Ruffalo, and I'm a research specialist in the Institute for the Study of Crime and Justice. We're about to present the second panel on re-entry partnerships, what works and what can work, exploring city, state, and community partnerships. In the interest of time, I'd like you to refer to your folders where you will find your detailed biographies on the esteemed panelists, moderators, and speakers that we're honored to have here today. It is now my pleasure to introduce the moderator for Panel 2, Representative William Dyson. Representative Dyson, together with Representative Lawler, was the driving force in the legislature for the Justice Reinvestment Initiative, beginning with Building Bridges 1 in 2003. He has been serving the members of the 94th Assembly District in the House of Representatives since 1976. He is a member of the Judiciary, Commerce and Planning, and Development Committees. The former longtime chair of the Appropriations Committee's past legislative positions include membership on the Human Services Committee, 2 terms as Assistant Majority Leader, and 1 term each as Assistant Minority Leader and Chair of the Black and Puerto Rican Caucus.
So we're going to proceed just as the names are listed here, and we're starting first with Stanley Richards.
Good afternoon, everyone, and thank you for inviting the Fortune Society to be part of this. I'm going to start off briefly with an overview of the organization so we can move along, because I too want to get into the dialogue about how do you build community partnerships and governmental partnerships that address the issue of reentry for formerly incarcerated people. The Fortune Society is a 40-year-old organization that provides a holistic range of services for men and women returning from prison and jail and youth at risk. Our motto is described as low threshold, multiple points of entry with long-term intensive engagement in services. Our 2 newest ventures have been on the housing side, where we provide housing for men and women coming home from prison in the Harlem community. We provide emergency housing and phased permanent housing. And just recently, we started what we call the David Rothenberg Center for Policy and Advocacy, where we're taking our advocacy mission to the next level, where we're educating the public about the realities of prisons and jails, and we're talking to legislators and community members about addressing the issue of the men and women coming home to our communities. I look forward to questions, and I want to pass it on.
Good afternoon. I'm Esther Armand, and I also will be very brief. I'm here this afternoon representing the City of New Haven. My boss was planning on coming, but she had to be out of town, but she asked me to come because she felt that the presence of the City of New Haven here today is very significant. In 2008, the mayor has announced reentry as one of his priority goals, and we feel that that is very important after looking at this whole issue of public safety for several years and tracking what is happening there. However, I realize that many of you have been at the table, and we're new to the table, and we came today to learn, listen, figure out ways how best to appropriately join in to make a difference, because it is important that we all do more to make this issue work. Hopefully, the City of New Haven can be a critical point in helping to connect some of the things that need to happen from not only from a policy but a service capacity building framework to connect communities, resources, hopefully state communications, and collaborative efforts that really connect to those communities that are most impacted by this issue. We all know, I believe in this room, that New Haven is a community that has a significant population not only going to prison, but also returning after re-entering the community. Those communities that are most impacted are made more vulnerable by re-entry not working. And it's not only for the inmate, but for the families, the children, the taxpayers, all of us are affected by this issue. So in coming to the table, we hope that we can not only help to build some capacity, deal with some communication linkages, but also deal with strategies that make sense and involve key stakeholders at all of these different levels that hopefully will make a difference, not only around reentry, but public safety and the lives of the families that live with this issue from day to day. Thank you.
John.
Good afternoon, everyone, and I appreciate the invite. My name is John Rowland. I am the director of the Corporation for Supportive Housing Southern New England program, which is Connecticut and Rhode Island. And my interest in this subject is around housing as part of reentry for ex-offenders and how that is a critical issue for many of the issues that have been brought up today. I've heard housing has been mentioned very little. And I think it's because we're still trying to figure out how we make those connections between the services, the Department of Correction, the Judicial Department, and Social Services work in a more fluid manner. And of course, there's also the issue of the political and the social climate right now around rehousing ex-offenders that we're very concerned about. We also understand community issues and community support issues and the NIMBY issue around many exceptional populations, not just ex-offenders, but persons with mental illness, HIV/AIDS, and substance abuse issues. What I'm going to briefly describe what I had come to prepared to talk about were some exciting collaborations that have actually worked to house exceptional folks in our community. We have on the state level what we call the Interagency Work Group, which consists of the Department of Economic Community Development, OPM, the CHFA, Connecticut Housing Finance Authority, DECD, DSS, and one other issue, DCF, Department of Children and Family. Each one of these groups, each one of these commissioners signed on to an agreement that said that they will work, they will assign an individual with the sole mission of providing housing for persons with disabilities, housing for persons with HIV, housing for persons with substance abuse issues. The Department of Mental Health and Addiction Services is the agency that does most of the service funding for these programs. So the issue here, what I'm trying to get to very quickly because I know we have time, that's one program that has worked for 15 years to create over 3,000 units of housing in this state. 1 out of every 5 cities in this state has supportive housing in its community, cities in their neighborhoods. And it works. So I'm hoping that at some point, the Department of Corrections, the Judicial Department, sits down and understands that there's a mission. You have a mission here in connecting your clients with community, and housing is one way to do it. I'm not suggesting that supportive housing is the only way. My colleague Patrick Hines has an interesting program that works well for a particular population that he works with, and so housing as a continuum means that housing, there are different formats to create those opportunities. But I am saying that there has to be it's important that there's a very, very concerted effort and a very precise mission statement for individual agencies to work with. That trickles down to communities because once you have a very concise and very singular mission, the communities want to become part of that. And that's what we found out in our program. We also have a program that has been funded by the Hartford Foundation. We call the Small Towns program, which is designed to educate key stakeholders in small towns, suburban towns that are much more reluctant than urban towns to accept what we call exceptional residents. That program begins by helping communities define what the issue might be. But let's define the need. Once they define the need, they go through the process with key stakeholders, neighborhood groups, select persons, mayors, whatever the form of government is, and let's work on developing a plan for the problem, to deal with the problem, and then let's engage the financing, let's engage the state, the federal government, whoever it is, to get the funding to make this thing work. It is an excellent program. It is a very, very detailed program that provides mechanisms and formats to include all those important stakeholders, to get them to the table, to have the conversations, to have the meaningful discussions around what are we going to do with our community members, because let's face it, all of us came from some neighborhood, and a lot of us want to get back to that neighborhood, and for some reason we just can't. So let's find out why, and let's work to get that to happen. So I'm available for any questions on that. I do have some materials, which outline the committee members. It outlines a lot of the processes that we use to develop these collaborations and to keep these collaborations fluid. I'd be happy to give those to anyone. I bought, I think, about 30, 40 copies of that information, and also where those communities that we're working in now to get housing available for those exceptional residents.
Thank you very much, Dan.
Okay, thank you. Dan Branchio. I'm the program director at Co-op Center, which is an agency of the Council of Churches of Greater Bridgeport. And Co-op Center has been, since 1973, providing reentry services to men and women coming back to the Greater Bridgeport community. I've been at Co-op Center for about 19 years now, last 8 as program director. And during that time, I have witnessed, I think, a number of efforts to bring agencies in the town together. You know, most of the agencies operated as standalone groups, programs that were working with their own populations, and there were some attempts to bring those together. But I'm very, very happy that in the last year, through the efforts of the workplace, especially Career Resources, Scott Wilderman, Liz DuPont-Deal, and Steve Lonzo over at Family Reentry, there was a concerted effort to bring together a number of providers that were working on a range of issues for people coming back into the community. And maybe just briefly, if I could just list those so you can get a sense of the scope of the number of agencies that are part of this Bridgeport Reentry Roundtable, you'll have some understanding of the different services that they bring to this table. We have Isaiah 61-1 Incorporated in Connecticut Renaissance, which both operate halfway houses in Bridgeport. Isaiah 61-1 operates halfway houses for men and women. We have Family Reentry, of course, which you've heard about, the Fresh Start program. Recently, they've just received funding to start, I think, a very exciting model based on the Delancey Street model, which would provide residential housing for a certain number and have it in a contained kind of a therapeutic setting. There's Community Services Incorporated, which is part of the roundtable. They recently have won the award for to assist DOC with the pardons application process statewide. Co-op Center, of course, there's the Department of Social Services, which again operates a fatherhood initiative, and also Bureau of Rehabilitation Services. There's a Center for Women and Families, which works specifically with families, has an ex-offender program connected with that, and the ABCD program, which brings to the table grants and training programs for hazmat, asbestos removal, that kind of thing, and also Connecticut Legal Services. A lot of these people are in the audience today, and I know they'd be happy to talk to you about those. But that kind of makes up right now kind of the core group, in a sense. We're certainly always open to other agencies coming to work with us and share with us. But I think the motivating factors that brought us to the table together were because of the fact that we were seeing an increased number of ex-offender clients in coming to the different agencies for services, and realized that we, in fact, shared these clients to one degree or another. We wanted to make the services as comprehensive as possible, and basically to do what I think best practices stipulate, which is to try to get in touch with these people while they're incarcerated and to have that community available to them once they get out. I don't think we've yet managed to get it to the point where we are starting contact with them as soon as they're incarcerated, but the pre-release work is certainly very, very important, we believe. In terms of output of the group so far, we have worked for the last several months. We're just about one draft away from a handbook of services in the community for clients that are returning to the greater Bridgeport community, and we hope to get that published fairly soon and get that in the hands, again, of pre-release counselors, people who can provide that information to men and women while they're inmates, so that when they come back, it's not a maze that they have to go to find the agencies that can help them right away. We've worked on grants together so far, and there have been people from our roundtable discussion group that have met with the Bridgeport Housing Authority, because they are looking at changes perhaps to their rules and regulations that would allow inmates with certain offenses to come back into public housing. And basically we meet about on a monthly basis to share information formally and informally. Pat Hines was down not too long ago to kind of enlighten us and also to share, help us reflect a little bit of our vision with where we wanted to go with the program too. So that's basically where we are. It's fairly new, but I think it shows a lot of promise. Certainly wants to enhance the delivery of services in Bridgeport. I think we would certainly agree that we haven't seen any clients, formerly incarcerated persons, who only need a job. I think as the people on panel one said before, there are many, many needs that people come back to the community with, spiritual, physical, material, emotional, medical, etc. So we want to try to develop that network, that safety net, so that when people come back, they have the best opportunities to succeed in the greater Bridgeport community. Thanks.
Good afternoon. I'm Teresa Lance. I'm the Commissioner for the Connecticut Department of Correction, and I am never brief. So you're going to have to bear with me as I kind of run through this. What I thought I'd do is try to organize this give you a quick little overview of the agency, what some of the things that we've been doing the last few years, what I think works, what I think reentry is all about and what it involves, talk a little bit about the barriers to reentry and where I think we need to concentrate in the future. And I will try and be fast. I became commissioner in 2003, and one of the first things I did was amended the mission statement to include reintegration and reentry as part of our mission. It's not enough that we do a confinement model. It's not enough that we incarcerate individuals. What's really important to enhance public safety is that we have to work on making a difference in these individuals' lives so that when they return to the communities, they don't return to recidivate, return to violence, drugs, and so forth. So reentry across the country was becoming a movement, and it clearly is, as you can see while we're all here today. But I really wanted to transition the agency from a confinement model into one that included more public enhancement and safety through reentry. So that's the first thing I did when I became commissioner, was to really change the agency's direction and refocus it. At the same time, I basically was following in line with a lot of the legislative leadership. Representative Dyson next to me clearly is a leader in the Judiciary Committee today, with Representative Lawler and Senator McDonald and Representative Walker and all of the other members are clear leaders and movers in the entire criminal justice system. But in 2003, I also became chair of the Prison and Jail Overcrowding Commission, and one of the things we did in that commission was we really got back to the basics of collaboration, cooperation, coordination, and partnerships. So in 2003, we led the nation in Connecticut in the reduction of our prison population after decades of growth. Decades of growth. In 2003, we actually reduced that prison population through our collaboration and cooperation with nonprofit providers and with our other sister agencies, and working together with these individuals to try to transition them back safely into the community. In 2004, we also reduced the incarcerated population. In 2005, we reduced the incarcerated population in this state after decades of growth. And actually, we were one of the leaders in the nation in how we partnered and how we collaborated and worked together and how we transitioned and how we try to develop programs and services to transition the offenders back into the community under some type of supervision and intervention. Also in Public Act 04-234, which the legislature passed, really clearly gave us a focus and resources to be able to really enhance all the things that we were doing. Everything from increasing our staffing levels to our halfway house beds. We were able to contract more in the halfway house, working with our partners in judicial and CSSD, with probation, and diversion programs with Department of Mental Health and Addiction Services. All of those things, because if you really want to look at how we manage limited resources in state government, we know that if you're going to invest all your resources into a confinement model, if you're going to invest it in bricks and mortar, it's going to give you the least result when it comes to enhancing public safety. But it's also going to cost you the most. So how we look at public safety and how we address it clearly is not to be totally focused on a confinement model or an incapacitation model, but clearly you get the most bang for your buck and you increase and enhance public safety by looking at other areas in the community, prevention, diversion, and then the reentry services when individuals are discharged back into the community. So Public Act 04-234 was monumental, and in fact, it was Pew Trust Fund recognized it as an innovative legislative focus for the state, and we were seen, and I think continue to be seen, as one of the model states in the country for how we address the whole issue of public safety and our response to crime. Now, 2006, we did see a slight increase in our incarcerated population, and that primarily was due to the youth violence in the cities. 2007, of course, has been a different story. We have seen a significant increase in our population. In fact, today we're about 19,740. And a lot of that has to do with the events from the summer. And so we're going to continue to work and continue our collaboration, and we're going to continue to focus. And with the cooperation and collaboration between the branches of government, I think we're going to bring the count back down, and I think we're going to enhance public safety. What works? We know that reentry works. If you were here this morning, or you know what Dr. Cox's presentation, and you saw that as we transition offenders back into the community, that enhances public safety. So we know that reentry, it reduces relapse. If it's done effectively, it's going to reduce relapse, it's going to reduce revocation, and it's going to reduce recidivism. That enhances public safety. We also know that partnerships and collaboration, we also know that transitioning offenders into the community rather than end-of-sentence discharge, that works. That reduces relapse, revocation, and recidivism, the opportunities, the chances, the motivation for that. So we know that those types of things work. We know that what we have done in 2003, 4, and 5, and even 6, and even now, we know that it works. We're up here with all our partnerships, and we know what the results are. We are making a difference. So we're going to keep working on that. So we know that those types of things work. Reentry. Reentry to me is it's a four-stage model. In order for it to be successful for reentry, we really need to do effective risk and needs assessment of offenders. We need to know what risks, what are the risk factors, what is it that we need to identify, that we need to address either through interventions and or supervision, and what are the needs. Risk management is the second area that we have to focus on when you look at the reentry model. And what risk management is really having the staffing available, the supervision, the management of the offenders, and all of those things in place so that the offender is held accountable and is given expectations for responsibility to be law-abiding. And risk management can include your probation officers, your parole officers, any of the GPS, electronic monitoring. It can be any of those things that enhance the accountability of offenders. Risk reduction is the third. And when we talk about risk reduction, we're really talking about targeting programs that will really intervene in criminal behavior, whether it be criminal thinking or whether it be substance abuse treatment or anything that is going to be an intervention that is going to impact how the individual thinks and their attitudes, values, and beliefs and how they behave. So that's the third one. And then the fourth one that I count in the model is research and evaluation. It's critically important that for the reentry model to be successful that we have appropriate research and that we can evaluate all of the programs and services that we do, and we keep tabs on that. Now, what do the inmates tell us their barriers to being successful upon going back into the community? We did focus groups. You might as well go to them. What's the issue? What are your concerns? What are your fears? The first thing, employment. They need to have sustainable employment that's going to give them the funding and the support that they need to be self-sufficient. The second one was sobriety. They know that they need not only programs inside to help them with their substance abuse, but also programs on the outside that transition them and keep them on the right path. Sobriety was the second barrier they spoke of. And then when we looked at the others, it was housing and mental health. Those are critical areas. So if we as providers and we as correctional administrators and legislators and in the judicial branch, if we know that these are barriers, these are things that we can target, these are interventions that we can target that can make a difference and ensure public safety. What's the future? I knew that's why I'm sitting next to him. What's the future? You know, as we all are trying to prepare offenders for successful community reentry, we also have to prepare the community for reentry. And I think the partnerships, the more we work with the communities, the political, the government in the communities, I think that is going to pay off in multiple dividends. And I truly appreciate the opportunity to say a few words today, and I also appreciate everybody here. Thank you.
And you're going to get another chance to, Mr. Carbone, question and answer.
Thank you, Representative Dyson, and this is a good time for me to acknowledge the many, many years of Representative Dyson being in this business, long before there ever was the Cheshire incident, long before all the newspapers have been paying a lot of attention to it. He was there. Many of you remember the initial Building Bridges conference here at Central many, many years ago. I'm always intrigued at the term reentry because it seems to mean for most people that we're talking about a group of individuals who've been incarcerated and are coming back into the community. And I always tend to define it in a larger way, that we really need to worry about those who are already in the criminal justice system as well, though they may not yet have risen to the level where they are incarcerated. Because I suspect that if you took a slice of the population today among the people who are sentenced, you wouldn't find very many for whom it was a first offense. They probably had some history in the probation system before. So if we only look at it from the standpoint of folks coming out, and this is in no way attempting to minimize that, I think we're not really looking at it comprehensively nor systemically. So I think in the last 30 years that I've been in this business, I've seen a lot of change and a lot of difference. And so the subject of this is what works. Well, one of the things that works is what we have in Connecticut, which is really unprecedented, bipartisan, by branch, and interagency cooperation. And this pre-existed the Cheshire incident. Teresa Lance mentioned this in her remarks. But we've been acknowledged by the Pew Trust Foundation last year as having accomplished what very few states had accomplished, namely control of the prison population to the extent that it actually did drop for several years here. And in their report, it acknowledges the very balanced and the very thoughtful and considerate legislative, executive, and judicial branch policies that created that. So I'd really like to acknowledge all the legislators who are here on both sides of the aisle, who I've observed work together to try to get a good crime control policy that works not just from the standpoint of public safety, but also invest very importantly in the whole area of rehabilitation. We didn't have that many years ago. We do now. Another change that I see is we have research. I can tell you, even as late as the early 1990s, when we created the Alternative Sanctions Program in the state of Connecticut, and we had to design the continuum of sanctions that the court would have access to, there wasn't much research on what works. That is not the case today. Both nationally and in the state of Connecticut, we now have a lot of research on what works. And we know that even the best, most research programs don't work for everybody. So we have to accept, and I think our speaker this morning from Michigan stated it, that despite the best of efforts, there's always going to be those disappointments in this business because we don't have crystal balls. You know, we can use the best assessment tools, and Teresa said those are key parts of the strategy. We can use the best assessment tools that the market and science can make available to us today. And though they may be actuarially sound, they're not perfect. And so the important thing is those kinds of mistakes, those kinds of tragedies will happen. How is the response to it? And that's what leads us really to where we are in Connecticut today. So I'll tell you from my standpoint, especially from the position of adult probation, what I think we now know that we didn't know some years ago. I was very happy that Professor Cox in his presentation this morning shared with you 2 years of research that we now have on the probation transition program and the technical violation units. Because even when we began them with strong support from the Prison Overcrowding Commission, from the Office of Policy and Management, we were not certain that they would work. Their purpose was to reduce technical violations of probation and ultimately to reduce the total number of persons who are incarcerated for the violation of probation. In fact, the Public Act that Teresa Lance mentioned, 04204, I think 234, specifically called upon the judicial branch to reduce by 20% the number of incarcerations that result from technical violations of probation. So we put together a group back then of practitioners, of probation officers and service providers from around the state, and said, if our mission is to reduce technical violations of probation, what do you think are the essential ingredients? And we did a little study. We took really a handful of cases from the Hartford office, maybe a couple of hundred cases of people who had served split sentences. And we learned that, you know, the rearrest, if they were to occur, generally by the 6-month point, it happened. We also looked further into the individuals behind those cases and found basic needs were missing, things like housing, employment, and we found that they were often on wait lists to programs. So what came out of that study was the model, the idea that Professor Cox shared 24 months of research on this morning. And it had some basic elements to it. Number one, let's have dedicated probation officers with limited caseloads. And let's be sure that those officers connect with the inmates long before they're released from incarceration, so that on the day they are released, they are connected to community services and they have a supervision plan. Some people said to me, well, you know, that's the way probation used to be many years ago when we didn't have 57,000 cases. So that's the model, that's the design. And now we can see, 2 years later, substantial differences in the technical violation rate. Last year, it was in the 41%. It seems to be sustaining that. And then when you look at incarcerations that result from this and you compare it against the control group, once again, a tremendous difference. And that influences the population behind bars, the cost to the taxpayers. So what should we as criminal justice practitioners take from this 24-month experience? Well, number one, here's what it teaches me. That our assessment tools, and we use the level of service inventory, are doing a pretty good job of identifying the criminogenic needs of offenders, and I'll use that word. Dennis Schranz this morning said he dared to use it, but we know what it means in this business. It's those factors which, if left unchecked, are very likely to lead to new criminal offenses. Our assessment tool in Connecticut has been researched here in Connecticut, not just nationally, and validated to accurately make that prediction. Doesn't mean it's 100% accurate, but it's the best that science can presently buy. The second lesson I draw from all of this experience is that manageable caseloads do work. That when you give probation officers, and the same would be true for parole officers, the time to spend with clients so that they can respond when they see the beginnings of relapse, so that they can connect them to housing, to employment, to entitlements, so that they can monitor them closely in terms of their referral to treatment programs. And you have that officer stay with this individual for the first 4 to 5 months. What do we see? Well, those were the data that were showed this morning. You can make a difference, and you can substantially make a difference. He said statistically significant. So we should say, well, fine, that's a good strategy. How can we apply it to more than just this population? That's the challenge that we should be saying, because we've learned something. We also know the converse, that when you give officers overloaded caseloads, you get the opposite result. You get more violations because they don't have the time to follow up on people who are in technical violation, and it's very important that they go on the record officially acknowledging that they're aware of that behavior and take some action in the form of a warrant to do something about it. So we have a choice. The second thing I just want to add, this, and then I'm going to close, is it's not just the officer and it's not just the caseload, it's the treatment services. And so we're learning that there's evidence out there about what works for this population. And we can't keep people on wait list. We can't not have programs geographically available, because in the meantime what happens is that they begin to slip. So in summary, the lessons that I see from this: we're using the right tools. We know that manageable caseloads is a key strategy. We know quick access to the services that people need, both basic needs as well as treatment, gets us lower violation rates. When we do that, we help to control the prison population, we save the taxpayers money, and we keep families together. This sort of reflects on the support enforcement presentation this morning. And the most important thing is we're contributing to safer communities throughout Connecticut. So we're learning some good things, and I hope we can all together continue our collaboration in the future so that we can apply them. Thank you.
Thank you. Maureen?
I'm the executive director of an agency that's been around for 132 years, basically providing services in this arena. And I've had, in some instances, people come on our board and they'll go, well, how come we haven't heard of you? And for those of you in the criminal justice arena, you realize many times that you try to do the work you're doing and you do it quietly. Because unfortunately, sometimes when you get too visible or vocal, depending on the point of view around your services, you run the risk of being criticized for what you do. And the reality, when all is said and done, is that reentry, I think, basically is designed to provide hope. Reentry should be meaningful hope for individuals as they try to transition to our community. And as we try to identify what works, if you can just bear with me a little bit while I point out some of the challenges that the system has in really trying to effectively provide the resources for what works. And a huge challenge was identified this morning by the keynote speaker, in that all of you sitting in the room are the individuals that are currently involved in the system in one way or the other, and we're preaching to the choir. There are individuals out there, just as though the issues of hope exist, the issue of fear is a huge factor as it responds to the issues around reentry. That we have fear for people who are not aware of the depth and the value of adequate and appropriate reentry services. People who are not aware of the fact that adequate reentry services results in safer communities. It helps to reduce recidivism, and it also helps to reduce the cost of incarceration to the state of Connecticut, which I think the general public needs to hear and understand. Having had and I must say it was a pleasure and it really was a value added to myself professionally, the opportunity to sit on the governor's task force. One of the first exercises we went through was people was asked in the room, and I won't say who said it, but it's on tape, but the question was asked, what do you think we should do in order to really rectify this situation? And the person's response was to abolish parole. And that was a sincere response from where they came from, because in their mind, given what had happened in Cheshire, parole was really a source of concern in terms of our ability to have effective reentry. Well, by the end of the process, I think collectively everyone understood that individuals who are on parole have a lower recidivism rate, and to that end, the value of having parole is a key component of the reentry process. Our reality, too, as we're providers and professionals in this field, is that 96% of those people who are incarcerated are coming back. And again, I think it's a missed opportunity or something that the community at large does not really embrace or understand. Because in our minds, with our sometimes tendency to think that we can fix things with quick fixes, the idea is that we've sent them away and they're away, and so we're now all safe. And the reality is people are coming back to the community, and there's an opportunity to really have them come back in a more prepared way. And to that end, providing resources is a critical component of that. Some of the issues that exist, I think, with the issue of reintegration is that there's an increased pressure, and we've all seen it recently, in the criminal justice system to basically identify the system as the only way of solving the social ills that exist within society. And many times, I often say when we do these forums, we need to have representatives from the area of education in the room, because we know it starts early. And to that end, when we get to this stage of the system, we're all baffling with how to solve it, but it's certainly a larger issue and a larger picture. There's a persistent pressure out there to be tougher on crime, because somehow the community has translated that into the fact that if we lock someone up, then we're tough and we no longer have the problem. And I am always one who says, when I hear that they've put somebody in isolation, and they're in isolation for 23 hours per day, and I think of the basic need of a human being in terms of contact, and us not realizing that what we're creating is a more isolated individual who will at some point hit the street with low social skills, with the inability to make the adjustment that's necessary to become an effective member of society. And so somehow those things give us comfort, but when all is said and done, it's really not an effective way. I think it's a punitive way, and some of us sometimes have to understand the reality of it. But what does it net us when all is said and done? There's a significant racial and ethnic disparity issue in the state of Connecticut. I think when it comes from, and Glastonbury has put up as a perfect example of a community that deals with their young people through a lot of diversion. In high crime communities, unfortunately, those diversionary type of activities are not available to our young people. And so we criminalize them at a very young age, and we start that process. There's a lot of bifurcation between the suburban communities and the urban communities in how we address this issue. I think in many instances, people look at their value systems and decide, if you don't fit into my value system, then you obviously can't be somebody that's worthy of resources and a future. The public perception issue as it relates to reentry continues to also not recognize that time in prison is extremely expensive, and that longer prison terms doesn't necessarily result in people not returning to prison, and that focusing on more effective type of reentry services that's designed to address the human component of individuals is a better mechanism for trying to do this. And so what works? I'm wrapping up, Bill. Yeah, I could see his eyes. We need to extend these kinds of dialogue to a larger audience in this room. We've got to start getting our message out to individuals who really don't have a true understanding of some of the basic needs of what it takes for reentry. It's not just about punishment, but we have to be more educated about the things that we do. I think for those of us who operate programs and the NIMBY effect becomes real for us, the realization that we've got to rethink, are there incentives for certain communities to participate in this reentry process? The urban communities are feeling overwhelmed with the fact that other communities don't want to accept or provide resources in their communities. So is there an incentive there for someone putting us in an industrial area and feeling safe at the same time, but nonetheless giving us an opportunity to provide these services? And certainly I don't need to preach to the choir about the need for strong programming around substance abuse, employment, health issues, et cetera, as part of that process in getting us prepared to do this. So thank you very much.
Thank you very much. So now, after listening to the people that you've listened to, questions? Anyone with a question? And I prefer it be a short question, but anyone with a question? Yes, use the mic. But I want the rest of the people
I
here.
have just one question, because we brought up Stanley from New York because of what New York's been doing down there.
Okay.
And we really wanted, one of the issues that we wanted him to address is the housing issue, the NIMBY issue. And I know they've had some real success. They have a 59-bed facility in Harlem that they were able to bring there, and then they have plans for a new facility. I'd just love to hear some of that story and how they were able to do that, because I know it's been difficult to do in Connecticut.
So you want to know how they were able to succeed at what they were doing in New York to kind of help us along. You got that?
Yes.
Okay, good.
I think so. Two things. One, we faced tremendous community opposition when we purchased the castle. That's what we call the Fortune Academy. The community was outraged. They didn't want formerly incarcerated people there. They had all of the horror pictures that they heard about in the news. And we were just committed to be a good partner. When we purchased the property, we went to the community, we went to local officials, and we told them we were coming, and we went to all of their community meetings. We went to every community meeting that they was holding. We listened to what they had to say, and we invited them to be and experience what Fortune was about. As I said, Fortune's been around now for 40 years, but at that time it was 30-something years. And so we invited community members to come in and to see who we are. And then we realized that what the community was saying was, yeah, they were afraid that their children were going to get hurt, the community was going to be worse. But at the same time, they was also saying that that building was an eyesore for the community, that that building was drug infested with dealers and users, that they've had community members, community service providers come into their community before and say, we're going to be committed to providing services, and after 5 years or 10 years, they left the community, and they often left the community worse than the community was before they came in. And we heard that, and we addressed that issue, and we talked to them about our longevity and our commitment to not be just a residence, but to be a community member. And it took some time, but today we have a community advisory board that's made up of the same people who were protesting against us. We, a couple of years ago, took in a very notorious formerly incarcerated individual, and the community was protesting us because we took that person in because we have low threshold services, and we do a risk assessment, but the risk assessment is danger to the community and danger to the residents, and we didn't feel like this person posed that. And even as they were protesting us, they said to the news, we're not protesting Fortune Society. Fortune Society has been a good neighbor. We're protesting this individual that they allowed into the academy. And so we've developed strong community relations. And until today, we go to 9 community board meetings every month. We send a representative there. They use our community space for community board meetings. We went to the community board and asked them, because we have a vacant lot right next to our academy, we asked them, what does the community need? They said affordable housing. We're now putting together a 114-unit affordable housing program that's going to serve that Harlem community, that's going to serve men and women coming out of prison, but they're going to be beds for the community as well. So we really became a community partner, and that's what it took to sort of turn the community opposition into favor of us.
Thank you very much. Now, your question?
Real short.
Okay, and who's the next questioner?
I want to applaud the gentleman from New York, so it must mean that you have excellent communications with the Judicial Department in order for you to be able to intervene into prisoners' life before they get out. Mr. Carbone, I appreciate your probation officers and their 4-month intervention in prisoners' life. Why can't we, in Connecticut, get service organizations entered into the system early? Because 4 months, like, the threshold's 6. They can wait 4 months, but on that 6th month, if they don't have anything, and then when you're mandated, most probation officers will do 4 months, and they'll say, well, I'm done with my job. So if we let service organizations in sooner and give them that access to databases, will it make a difference, or is there a problem with sharing information with social agencies?
No, as a matter of fact, I view the relationship as a partnership. Maureen, for example, the Community Partners in Action manages many of our both adult and juvenile programs. We share virtually all of the data that we can legally share with them. All of our assessment tools, for example, are shared with the private agencies to which we make referrals. And I think your point is correct. They need to be brought in early. Certainly when you're talking about split sentence people, it has to be before the day of release. We know the alternative. If you wait until a person gets out and cause months to go by before basic needs are met, you're likely to have someone that's going to be rearrested and then back into the system. So I would agree with you on that point, and I believe we're trying to practice that.
Is there someone for them to call service agencies to get in touch with so that you can know that information is dispensed? Is there someone inside the DOC that service agencies can call Mrs. Lance?
Sure. Sure, you can call, are you talking about for the community services?
Community service, in-house services, that service agencies can come inside the DOC to
Sure.
begin advanced preparations for.
Sure. In fact, about a little over a year ago, I established a reentry unit an actual unit right in the agency for the first time. And Joe O'Keefe is the director of that, but also Pat Hines is here. And Pat, why don't you raise your hand? Dr. Hines is the director of our programs, and he does he oversees a lot of the reentry services and the connection between incarceration to the community. So if you'd like, you can contact him. Pat, 692, what's your number? 692 7642. That's Dr. Hines.
Do you have an open door policy?
As in what does that mean?
That if it doesn't go right, can we call your office?
Oh, you can always call my office, obviously. And I will make whatever whatever referral or whatever. When you said open door, I was going to say, folks, I love you, but I can't entertain all of you in my office. So yes, we will address any and all questions, concerns, and so forth. So absolutely, you can directly call my office. I was just giving it straight to the guy that would actually do the work.
Let me help you out with something. Yes. Whenever you speak to the boss, and the boss directs you someplace,
Yes, sir.
take it to the bank.
All right.
Don't question it, take it to the bank.
All right.
Now, if you go to the bank and find out there ain't nothing there, then you got some reason to complain. Okay, so there it is. You got it. You next, honey.
Good afternoon. My question has a lot to do with the substance abuse issues. We know that 80% of the population that is incarcerated are people of color, and it's also the same amount of number of people that have substance abuse issues. So when are we going to stop incarcerating people who have a disease and start building treatment facilities and helping those people with their treatment and beginning that process and not making them felons, but, working with that disease? Because I believe the federal government classifies addiction as a disease or a disability, and why we're punishing people with disabilities. That's one question.
Who you directing that one to?
To anyone that has anything to do with.
You probably won't get an answer when you do that.
Well, I'll direct it to.
Direct it to somebody.
Okay, I'll direct it to Commissioner Lance.
Okay.
And to Ms. Price.
Okay.
As far as you're absolutely right. We know that 88% of offenders who come into our system self-claim a substance abuse issue. And so we've tried to target the substance abuse programs to the population, and we try to do the reentry with substance abuse as part of the program plan. The parole board, when they make decisions, they also look at it as well. As far as individuals not coming into the system, that would be the judicial system. As you know, the Department of Correction must accept everybody committed to my custody. And so if you're looking for prevention and diversion programs, clearly, I think that's something we've been talking about. Department of Mental Health and Addiction Services, we've had a lot of collaboration with them. Judicial has had a lot of collaboration with them as well. As far as the legislative or the laws pertain to it, that's the legislative branch. You have some representatives here that you can talk and lobby to about that. So there's a lot of avenues and there's a lot of things. I'm a big believer in prevention and diversion. Once you become incarcerated, we know the collateral consequences of that. I'm not soft on crime by any means. Absolutely not. I know that there will always be a role for prisons. But if those individuals who pose more of a self-harm to themselves than to self-harm to others, those are the individuals that may not need to be incarcerated, specifically mental health and sobriety issues and so forth. And I'm clearly into diversion into the community for that. It's more successful, it's less expensive, I think it enhances public safety. And I think you want to build a person's ability to be self-sufficient, not to be dependent on incarceration to keep them clean. So that's where I really come from, and that's the type of message that I try to give. Thank you.
Maureen?
Well, just to probably agree with you wholeheartedly that there is an absolute need for additional services, and that 88% of the people who are incarcerated have identified it as an issue. Conversely, however, I think to kind of speak to my issue about the bifurcation in the community is that 88% of those who are dying from overdose are white individuals. And to that end, there is clearly a substance abuse issue that I think crosses lines of community, financial status, et cetera, et cetera. However, as it relates to the policy side of it, I feel a need to make sure that Bill answers that question when the next panel comes up. Legislator, yes.
Yes, because one of the policies that do incarcerate urban people, that don't incarcerate suburban people, is the 1,500 feet drug-free school zone. And most of, people in our neighborhoods and urban communities.
I'm just passing the buck.
Maureen was trying to give you a coded message
Yes, I
about.
understood her message.
Okay, all right.
Make sure people get educated on the drug-free.
Okay, we need.
Policies that hold people of color hostage.
Okay.
And while people in suburban communities are dying.
Okay, we got it. Now, Mr. Carbone is going to respond too.
Well, I totally agree with the point you were making. One of the most concerning things I see every week is the list of people who are on wait lists for inpatient programs within the court support services. And I just saw it yesterday. It's over 400 people waiting to get in to treatment. And somewhere around 260 of them are incarcerated, and they're interviewed by jail re-interviewers, and the bed is not available to balance our people on probation, doing poorly, and in fact in need of a higher level of treatment. I think it raises a couple of issues, and that's we need to have some alternative to inpatient because of the time it takes to develop inpatient beds and the expense. And we need to develop perhaps intensive outpatient substance abuse and bring other supports in for people in the communities where they live, including supervision, but other kinds of supports, whether it's employment or housing or people with co-occurring disorders, mental health services, because there's a growing need for inpatient services that far, far outstrips our capacity.
Dr. Hines has personally been in charge of identification. It is a tremendous barrier to a reentry and people being successful in the sense of getting jobs and so forth. You have to have a primary, you have to have secondary. We have a secondary ID that we can issue an offender, that we've gotten approval to do that, but you still need a primary, state government driver's license, a birth certificate, social security card. We have got relationship with Social Security Administration to expedite getting us Social Security cards for the offenders. We also have been working very closely with DMV. We're very close. We're talking about a month away to really, we had a meeting. We're looking at the DMV coming in and working with us and actually giving and providing a state government ID right at the facility level. So I think that's extremely encouraging. Long time in the process. I remember, in 2000 going to a couple of Representative Dyson's meetings, and we were still talking about it then. I think we're finally getting to, getting a handle on this. The birth certificates is the hard one. Trying to track down birth certificates for people who have been born all over the country can be pretty difficult, but clearly we're working on that. I think one of the most significant things we have done is at the time of admission to the agency, we are asking you then, do you have an identification? If you have it on you, we are going to keep it and protect it for you so you can have it when you get discharged. If you do not, we put it as part of our classification and our information for discharge, and we can immediately then start working with the offender to get some type of official ID, because that is a barrier. So we're working on that, and we've already started the identification at admission.
Just for the future, what is the current timeline for somebody who gets out of prison to be able to get an ID that's acceptable to an agency so they can start the process of reentering?
Well, we're doing that before discharge. We're trying to work on that before discharge. We're identifying individuals at admission now to see what the issue is regarding identification. So we've already started that process at least 45 to 60 days prior to an expected discharge, where we're looking at all of the things that you need. That's part of our reentry program. That's part of something that's new in the agency in the last year and a half, that we've actually really focused on doing those types of things, because we've heard over and over again how identification is a barrier. Thank you.
Okay, next question then. And I think unless there's someone else, that'll probably be our last one, because the next panel is going to hopefully get into all those things that you have some questions about, and you be able to do that to them. Go right ahead, sir.
Commissioner Lance, earlier you spoke about holding, for lack of a better word, the offender accountable through GPS tracking and parole monitoring. But don't you think you need to hold the current public safety model accountable for the fact that, as Luis was saying earlier, that we have a system right now that's criminalizing people with substance abuse problems and mental health problems? Right now, the jails are like de facto mental hospitals.
Who are you directing that to?
I think he's directing it towards me.
Okay.
Okay. Again, as the Commissioner of Correction, I have to accept and manage and supervise all offenders committed to my custody. So if an individual is coming in the front door with a commitment or a minimus from the court, I must take them. We do a needs assessment, a risk assessment, and that's how we manage the prison population. At discharge, basically, we're doing the same thing. We're doing a risk and needs assessment as to what are the needs, what can we do to assist the offender with discharge back into the community, whether it be substance abuse issues or whatever. To address your issue related to the sentencing structures and or penalties that are provided, that really is outside the scope of my authority.
I'm not talking about the sentence, I'm talking about the fact that, even as Mr. Caprone brought up, that right now that there is no adequate alternative to incarceration model for people with substance abuse problems and mental health problems.
So is it the substance abuse or the mental health issues that you're, okay. We've been working very closely, and we've made recommendations, and even Public Act 4234 gave us some avenues to address. Dealing with individuals who have mental health issues. We have jail diversion program at the courts, where DEMAS has professionals who evaluate individuals at the courthouse right there to determine whether or not their needs can be best met in the community rather than committing them to the custody of the Department of Corrections. So we're doing a lot of diversion. We're doing a lot of the jail re-interviews do the same thing when they come into the system.
So
I think
the current model is working?
I think we're working on a lot of avenues. Do I think it's perfect? Absolutely not. Do I think that corrections becomes a catch basin for a number of issues that people have in the community, such as mental health issues and addiction issues and perhaps unemployment and housing and so forth? Yes, I do think that corrections has become a catch basin. I do think it has become a very large social service agency in many respects. And I think that the more collaboration we do and the more partnerships and the more people that we bring in to the fold, I think the more we can divert individuals away from the criminal justice system into the community social service system, and I think that could be more productive.
The only response I would give you is that while there are clear gaps in the current system, it would be a mistake not to acknowledge that there has been steady and definite growth in the types of alternatives, including substance abuse alternatives in the state of Connecticut in the last several years. The problem is the volume of people now coming into the system as opposed to used to come into the system. And the second part of the problem is the multi-problem nature of the individuals that we're seeing, people with both psychiatric and substance abuse problems, as well as lacking in so many of the other basic needs.
But that volume, isn't that due to the current public safety model, which is like arrest and incarceration driven, as opposed to treatment driven?
Well, I think it has something to do with the treatment system. I think it's correct to say that, and the fact that it is not there in the community may in fact cause people to come into the system. But I just wanted it to be clear that we have made steady and definite strides in advancing various types of treatment programs for the population.
But I would offer that it is an ongoing process, same as addressing the subject of reentry issues, starting way back, and we're not there yet. And maybe 5 years from now, we still won't be there. But it is an ongoing process driven by people like you raising the questions you raised. So just keep doing that. Yes, you're the last questioner.
Yeah, I have two questions for the Commissioner. One is excessive phone rates for incarceration people and the burden that it put on people's families. I was incarcerated and I just came home, and I remember reading issue in the paper about that the judge had ordered the DOC to find a contractor that would change the phone system and the excessive cost or the excessive prices that they're charging. And that was like about 4 years ago. And I want to know what has happened since then. And another thing is, you said you for diversions and stuff like that. Then why did you cancel college inside prisons? Because I was in prison and I had reached 55 college credits, and then you just iced the program.
Well, I can tell you a couple things. Let's do with the phones real quick. I'm not familiar with what you just said. The court said that, because I don't ever recall the court getting involved in our phone system.
I have a copy of that.
In other states they did. New York certainly did that. But let me tell you what we did with the phone system, is that we had a collect call system, and the proceeds did not go to the Department of Correction. They went to the general fund, the state general fund. The contract is handled by the Department of Information Technology. I had no control over the contract. So it wasn't a DOC initiative or a DOC agenda. It was a state contract in order for those collect calls, the proceeds. We, quite frankly, through a lot of my influence, I said that we needed to reduce the burden on the families, and we needed to really, go back to a system or try to contract with a system that would provide it's kind of a debit system, but basically you can prepay the call, and it's at least a 25% reduction in the cost.
Right. I read about that.
And that's what we've initiated, and that's system-wide. So that has had, it's certainly not a zero balance. We do fund our intelligence system through the phone contract. In other words, the proceeds for our phone monitoring is out of that phone contract. That's how that's paid for. The company itself pays for that. So that's no cost to the state and no cost to the department. I did also go in and ask for legislation to have at least $300,000 of the funding that the state was collecting. If I could get at least $300,000 of the few million that was collected, so that I could use for programs, and I did get it. The legislature gave it to me, and I dedicated that all to education, which includes college courses as well as additional individuals to come in and do GED exams. And we have had a tremendous success in our school system.
When did you start that?
Probably we got the money 2 years ago.
I just came home in 06. And they canceled it, and you started it, and you have college for if you're 21 years and under. If you're under 21 years old, you can't go to school no more.
Well, there's very limited funding for college.
Yeah, but you just said you
Might I offer up as a way
Very
that we
limited.
can get to this, because it's an interest I have too. But could the two of you guys talk later? Thank you. I want to thank the members of this panel for their being here today, and with the intent of getting to the next panel. So just hold on, don't go anywhere, and the next panel is going to come before you right now. Thank you very much.
I'm sure that's an indication of how passionate everybody in the room is about that issue. I think we've had a lot of interesting conversations today. We started off with a welcome by the Speaker of the House, who elucidated on some of the points that thanks, Bill, on some of the points that he would like to address as he goes into the legislative session. We had a presentation from Dr. Stephen Cox from Central Connecticut State University, who I'd like to personally thank, along with Dean Susan Pease, for having the vision to start up an institute like the Institute for the Study of Crime and Justice here at Central as an effective way to bring academics to the policy discourse. And I think and I hope that it's a useful resource for folks not only within the Central community and the CSU system, but for those in the greater community at large. And he presented on what works from a statistical and a research and database standpoint in Connecticut. It was a small snapshot of some of the programs in Connecticut. Then we had Dennis Schranz from Michigan talk about his experience there and the successes and failures that they've had there, but the importance, I think, of sticking with something and being as dedicated to an approach over time as is necessary to get a certain outcome that you're looking for. I think we had a very enlightening panel after that from the formerly incarcerated individuals who were successful and have been successful, and the things that they found allowed them to be that way. And then a presentation at lunch from Joe Grealis of Support Enforcement Services, which shows how other agencies and other entities within the state that may not have considered themselves a part of this conversation have taken a step back and really wanted to become a part of it so that we do have successful outcomes. And then the last panel we just had was just a glimpse at some of the things we can do within the communities when we get down to the actual grassroots level to address positive change for reentry and safe communities. So now we step back and we look at from, I guess, in some ways 30,000 feet from the policy perspective, from the folks that make the decisions, many of the decisions in terms of reentry policy in Connecticut. And we have some pretty important and influential people up here today. And I think what we'd like to do and what I'd like to do as a moderator is kind of have it as a conversation. Some of them have been here all day. Some of them, I'm sure through their busy schedules, have joined us a little bit later. Each of them I'm certainly very appreciative, and I'm sure you are too, of their taking the time out to be here today. But I'd like it to be a conversation, maybe some to reflect on what they saw and what they've heard today. I know some people may have learned things as they came today and participated and listened. And then to also talk about what is the current state of policy with regard to reentry in Connecticut. Where are we now? We know we're in a state of flux in some ways, but where are we now? We got a legislative session coming up on January 22nd. We got a regular session coming up shortly after that in February. What are we going to be doing in the short term, and what are we going to be doing in the long term to address prisoner reentry? And we also have an individual here, Glenn Martin, who is also from the Fortune Society in New York City, who I'm very pleased was able to make it up here, like Dennis Schranz and Stanley Richards, and fairly late notice because of their passion for the issue and because Michigan and New York have had success with this, and maybe they can share some of that success with us. And Glenn has really had his finger on the pulse of New York, and in particular New York City. He first came here in 2006 as he was co-director of the National Hire Network, an entity that is a national clearinghouse for information on how to provide useful resources for individuals on a statewide level, a community-wide level, and individual level for individuals looking to gain employment that have a conviction. So I'm looking forward to hearing what he has to say about New York City and some of the ways that they've been able to reduce crime rates and reduce prison populations at the same time. So I'm not exactly sure how to start it off. If anybody would like to just somehow address what they've seen or heard today, I'd certainly be welcome and open to that. I'd like to have questions at the end, a few questions from audience members as well. We have Senator John Kissel here from the ranking member of the Judiciary Committee, who's been working with us on the Connecticut Sentencing Task Force, and I know has been really invigorated in a lot of the work that we've been doing there, and certainly I'm sure can address some of the issues with regard to that. And I know he's also in his senatorial district has a lot of the correctional facilities and has experience dealing with the policy issues regarding correction as well. We have Mike Lawler, who I'm sure I don't have to introduce. to anyone here, is the Judiciary Co-Chair at the Connecticut General Assembly, who's been working on reentry not only on a statewide level, but on a national level, and is well recognized for his work with that. We also have Bob Farr, who's not only is chairman of the Board of Pardons and Parole, but is chair of the Sentencing Commission, or the Sentencing Task Force here in Connecticut. And we've learned a lot over the past year about ways that sentencing, and I know a gentleman had a question earlier about sentencing, and a few people have brought it up, can also impact reentry policies. We have Brian Austin, the Undersecretary for the Criminal Justice Public Policy and Planning Division at OPM, who's really charged with putting together, and they put together a comprehensive plan on reentry, and I know they're looking forward to doing more with that in the future, and they're a fairly new operation, so they've been getting underway here. And we have Marianne O'Neill, who's Governor's Counsel and sat on the Governor's Parole Task Force as staff on the task force and counsel to the task force, I believe. More or less. And Senator Martin Looney, who is from New Haven and is a majority leader in the state Senate, and who has, he's also not only got a policy perspective, but as well as with Representative Lawler has an academic perspective, because they're both professors in the field as well. And certainly has been a key individual up at the Senate in terms of forwarding reentry policy. So I'd like to open the table up to anybody that would like to address where are we in Connecticut with reentry, and where can we go, and maybe in the context of what we heard today, or what you would bring from your discussions up at the Capitol.
Can I chime in?
Yep.
You can get me. Thank you so much, and you can get me out of the way first. I'd be happy to do so. First of all, I want to thank everybody here at Central Connecticut State University. It's always wonderful when I step onto a campus. You just get a whole different vibe. It's all about learning. It's all about growth. And what a beautiful campus you all have. I want to thank Andrew and everybody associated with this afternoon and this morning's presentations. I know with the previous panel, I learned an awful lot, and every one of these that I go to, I learn an awful lot as well. I've been lucky enough to be the state senator for communities in North Central Connecticut for the last 16 years. And in my capacity as state senator for North Central Connecticut, I also have 7 correctional facilities. McDougall Walker, Carl Robinson, Enfield Correctional, Willard Cebulski, Osborne, and Northern, also known as our Supermax facility. And in chatting with Commissioner Lance right before this afternoon's presentation, the population of the 7 facilities that I have in my district as of this afternoon is slightly more than 8,000 inmates. So 169 municipalities in Connecticut. There's probably a lot of small towns that might not even have a population of 8,000. We have 8,000 inmates in my district right now. It's also sort of ironic, I will tell you, that just a couple of days ago at the auditorium, a Good Corporate Citizen Northeast Utilities hosted the Governor's Summit on Early Childhood Education. And, you know, juxtaposing that and what happens to children that causes them to fall behind before they even hit 3 years old, and then now addressing prison reentry issues, it's all tied together. And it's all one continuum. And to the extent we can try to help children before they even hit the school years, we will eventually, and it'll take time, but you can address the prison population. So Andrew had said, let's start at 30,000 feet, and I'm happy to do so. One might wonder, Senator Kissel, you're a Republican, you're supposed to be all law and order. What's your position on reentry? And I sort of view it as redemption. And it is purely self-interest as far as this state senator, but I think in the best interest of the people of the state of Connecticut and just good public policy. I have those correctional institutions. I have those men and women that are correctional officers as my constituents. And I have also, as every legislator, we want to try to stretch those precious tax dollars as far as possible. To the extent we can address issues of reentry and redemption and learn from other states in the United States and break the cycle of recidivism, what that means to me is less burden on my communities that are host communities to these facilities, one. Less danger with increased populations to my corrections officers that are staffing these facilities. And these aren't just 5 days a week, 40-hour a week jobs. These facilities have to be properly staffed 24/7, every single day, holidays, no matter what. But if we can take an individual and successfully get that person back into our communities, I gain a taxpayer, I gain probably a dad or mom. I also probably stop a future crime from occurring, and so I lose a victim. Tremendous amount of positive gain by each individual success story. Also, as in so many other areas of our government, it's a lot less expensive, although more difficult to rally public support behind successful reentry programs. I think it's roughly about $50,000 a year per bed, per inmate per year. That's a lot of money. We had at our public hearing plenty of testimony that there are successful programs in the state of Connecticut addressing halfway houses, reentry, job training, sobriety, all of those other things that are so important, and they are far less expensive than $50,000 a year. In looking at, and again, I don't want to go too long because there's a lot of very, very bright and hardworking and dedicated folks up on the stage here with me, but in some of the places that I've gone to, and I got to be honest, it's been such an honor serving on the Judiciary Committee with folks like Senator McDonald and Representative Lawler. I mean, I got the professor here on my right, so I'm constantly studying just to keep up with the professor, and I'm never going to get there, but that's okay. In some of the seminars and other things that I've gone to in the last several months, what I've learned and what has become very clear is that other states are far along this path ahead of us. Connecticut, the land of steady habits, sometimes that's good, sometimes that's hard to change. But I think, as Commissioner Lance indicated earlier, we were cutting edge not too long ago. And as much as over the last several months I've been talking about crime and punishment, and we do have to get tough on violent predators that endanger all of us. At the same time, we can do a much better job at reducing that proportion of nonviolent offenders in our system so that those valuable beds are reserved for tough sentences for those that may be incorrigible. Ultimately, the vast majority of offenders will get released at some point in time, and we know without a doubt, scientifically, with studies, that if you just let people go, hi, here's your bus ticket, here's your $20, go back home, it's not going to work. It's not going to work in probably the majority of circumstances. If it's transitional, if there's a period of time where there's support services and reintegration, and we all commit sins, we all have problems each and every day. None of us is perfect. But if there is a support network out there for folks that want to turn their lives around so that the first time that something goes wrong, it's not back into prison, we have a much greater chance at success. Finally, I just want to say this. I commend Governor Rell. I firmly believe our governor understands all these issues. Right now, at a pay grade much higher than where I'm at in the legislature, there are folks negotiating how much money may be available during special session, if any, what the negotiation might be for next Tuesday, if any, and where we're going to go in the next regular session. But ultimately, I think Connecticut is a very pragmatic state. Whether people are Republicans or Democrats, I think all of us get it, and we're going to marshal the resources that we need so that we can reintegrate as many human beings, recognize redemption, recognize an individual's desire to turn their lives around, because ultimately it benefits each and every one of us in the state of Connecticut. And so that's my perspective on these issues. Thank you.
Bob?
Yeah, let me just disagree a little with Dennis Shane, was his name, from Michigan. I think he made a comment about we have to tell the public that it happens, that there will be failures. And I understand that, and I understand the public has to understand there'll never be a perfect system. But it ought never to be acceptable to us as public officials that there are failures, that our goal always ought to be a perfect system. And that when there is a failure, like Cheshire was clearly a failure, assuming that the defendants who have been charged with that are the individuals who did it, they went through a reentry program. And when you have a failure, you have to learn from that failure. You have to change your system and you have to improve your system. And every time we have somebody comes out of prison and commits a new crime, to me, that's a failure. And that ought to be unacceptable to us, and we ought to be working continually to developing the perfect system. Being realistic, I mean, it's never going to be perfect, but the goal always has to be to improve it. And the good thing that has happened is that the reaction basically in the legislature and the governor has not been to stop all reentry programs. It has not been, abolish parole, abolish probation, lock everybody up and throw away the key. But that would be an easy reaction because the reality people are coming out. But we all had to recognize that in this particular case in Cheshire, there appeared to be system problems. There were things that went wrong. And so what the legislature has proposed and the governor and the task force have proposed improvements in the system. Some of those systems were underway. Some of those systems will be acted on by the legislature. But specifically, when the decision was made on one of the defendants in Cheshire to release on parole, there wasn't information shared, adequate information shared with the Board of Parole. We didn't have the transcripts. We didn't have the juvenile records. We didn't have essential information necessary to make good decisions. We were in the process of working and negotiating and moving towards improving that system. But fortunately, the reaction of public officials in this state has been, well, if you were moving, let's move it faster. Let's accelerate the solutions. And what the legislature is talking about now is building the electronic systems that should be essential so that all the agencies can communicate. We're talking about giving us access to the juvenile records, which we should have had before. We're all moving towards improvement of the system. So I think what the message to the public ought to be is, yes, reentry does work, reentry improves public safety, but every time that there's a failure, we're going to continue to improve the system so that we get a better outcome, and that's what we ought to be dedicated to.
One of the things that we found in the past, though, and we put together a video that we produced in 2006, and we interviewed a lot of folks, and we talked about from 1979 up into that point. Well, actually, I'm sorry, 2006. Up until about 2003, we had just been building prisons, and we had been putting our resources into that, knowing that you have limited resources in the state. Once something like a Cheshire dies down, and then the next thing becomes transportation that you have to fund, the next thing becomes education that you have to fund, and there's clamoring to do that. How do you ensure that there's adequate resources for reentry, which is not a hot topic among folks? And the way that it was proposed to do it in 2004 was through a justice reinvestment, where you try to keep the populations down and then take some of those resources and reinvest it into the community. Do you see the available resources to address effective reentry within this upcoming legislative session?
I could talk about that. And, it's, Senator Kissel mentioned before, there's sort of like this equation, right? There's, you can free up beds for violent, if our goal is to lock up the true predators for as long as possible, one of the ways of accomplishing that is to take less violent or nonviolent or less serious offenders and punish them in a different way through some type of diversion program or reentry type program. And it makes perfect sense, and I think everyone would agree that the expensive prison cells should be reserved for the most violent, most serious repeat offenders. I think people would agree with that. But actually doing it is a little bit more complicated. And part of that equation is what Andrew Clark just mentioned, this notion of reinvestment. So we do know that at the moment there's more inmates than our prison system is really designed to accommodate. Whether or not there's too many is a matter for debate, but there's a lot, and there's probably going to be more in the near future. You heard the projections earlier. Right now we have 1,800 more inmates today than we had 2 years ago today. We have 350 more inmates today than we had on January 1st of this year, so that's what, 16, 17 days. It's gone up by 350. And those trends seem like they're going to continue. So we have a choice. We, the legislature, the governor, all of us have a choice. We can either build more prisons or do something different. Now, the building prisons is simple, it's just really expensive, and it may not be very effective. And so the reinvestment argument is, if there's a different alternative, can you estimate the amount of money you save by not building the prisons and invest some of that money in the very things that are allowing you for that trend to continue? And I think it's fair to say we were making a lot of progress in that direction in Connecticut until the Cheshire tragedy, which kind of upset the apple cart. And in a very unusual situation where you had offenders who were paroled, who had a job, had a place to live, were abiding by all the conditions, and they committed this unbelievable crime, it sort of took us all by surprise and really undermined, to some extent, our efforts in this direction. But it is what it is, and we have to do something. And so right now, the legislature, and this will be Tuesday, right? The legislature is going to have to figure out, how do we want to respond to this tragedy in a way that will actually work? So I think you're going to see a combination of things with a real focus on reentry. But saying we're going to do it and actually doing it are two different things. You know, I learned a very important lesson. I've been in the legislature 22 years, and legislators are always tempted sort of to assume that the solution to a problem is a bill, right? Changing a law solves a problem. And it sometimes helps, but for example, we had a law in the books for 10 years that said every time someone is sentenced to more than 2 years to serve, the prosecutor shall order the transcript and shall forward that to the parole board. And so for 10 years, that basically never happened. So what that tells me is just because there's a law that says it has to happen doesn't mean it's going to happen. And if you want it to actually happen, you have to ask the people on the front lines, what do you need in order for, here's our goal. What do you need to make this really happen in real life? And if we talked to the prosecutors, they would have told us, well, a little bit more money to pay for the transcripts. And just as important, we need to understand, why is this so important? Because I think it's fair to say they didn't really understand what the parole board did and why this was important to their decisions. And I think now they do understand, and now they are doing it. And now the money, at least initially, has been made available to pay for these transcripts. And so when we talk about reentry, I think for the past 6 months, the entire state has had a very good crash course in what these options really are and why reentry is important and how parole supervision really helps ensure lower rates of recidivism. But now we have to listen to the people who are on the front lines. The governor convened a task force, and they came up with recommendations. And they said, if you want this to really work, you need to do this, 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 and this. And by the way, each of these has a price tag. It's not just a new rule. I mean, you're going to have better victim notification technology and a better communications network and more halfway house beds. We need more options if we're going to take nonviolent offenders out of prison to free up cells for the violent offenders. Well, all the easy nonviolent offenders are already out. Like if you or I went to prison, I mean, you know, if we got out, we have a family, we have a place to live and stuff like that. But the offenders who are nonviolent, who are not being released now, have all these special needs. They're mentally ill, they're homeless, they have substance abusers. So you can't just release them because they're nonviolent. You have to have some placement for them. And it's the lack of those placements that is contributing to our prison numbers. So to free up more beds for violent offenders, we have to fund in a very real way and in a very immediate way these placements, these re-entry and diversion placements. And for us to say we're doing it by passing a law and not actually doing it by providing the resources, I think is a mistake that we can't repeat again. And so that's the debate we're having at the legislature. Are we going to just say we're doing it, or are we really going to do it in a very real way that many of you know what I'm talking about, right? It's one thing to say, here's our new plan, but if the money's not there to pay for these things, many of which can be done right away, then we'll just have been spinning our wheels and I think in many ways misleading the public. And when the next tragedy occurs, people can rightfully say, like they did with the transcripts, you passed the law, but you never followed up and you dropped the ball, so it's your fault, and which many people did say. And so all of us are in this boat. All of us in different ways run this system. And as Bob said, we have an obligation to learn from the mistakes that are made and make sure they don't happen again. And so that's our challenge for Tuesday.
I just want to, again, from sort of a Republican perspective and on behalf of the administration, because in the last few days there's been a sort of a sub rosa debate that's been going on. I have no doubt, and I am completely on board with Representative Lawler, that these things are going to cost money. And the administration, Governor Rell knows these things are going to cost money. There is a little bit of a debate right now as to when we come in next Tuesday for the special session, whether we simply address the very narrow issues that are the least expensive, that are policy, and with a commitment from the legislature that the money issues will be addressed in the next regular session, which is only a couple of weeks away, or whether there will be some variation thereof. Maybe not everything, but maybe some different components, 1 million, 10 million, 15, some variation. I don't know the magic number, and it's my understanding that that's sort of being debated right now. So I think that Republicans and Democrats, the administration and the legislature are all on board to varying degrees that these things are going to cost money, and to be successful and to be honest about it, we're going to have to dedicate the funds to make it work. How that translates into the special session versus the regular session, that's still sort of a bit of a question mark right now, although it may have been decided earlier today, and I'm just not aware of it.
Well, I get my counterpoint too then, if he did it, right? It's very brief.
But we're together on
No,
this thing.
and the good news, and it's very important to point this out, compared to other states, we have a very bipartisan approach to these things, and Bill mentioned that when he spoke. I mean, it's totally true, and we get along, and we have a slight policy, how to proceed disagreement at the moment. But the difference is, just so you understand, once the legislature convenes, we will end up doing some type of budget adjustments, but that will more likely than not happen 3, 4, 5 months from now. And what we're saying is there are some things that we can do today, and it's not a lot of money, and we're saying let's get that ball rolling, because for many of you who work in the nonprofit area, I think you've heard these promises before, and I think if we put the money in the pipeline now for the programs that can be done immediately, then I think the people on the front lines are much more likely to believe us when we say that the money is on the way and that please get up and running to the extent it's possible right now. So some things can be done immediately, and they should be done now, and then we'll do whatever the medium and long-term stuff is in the regular session. But our goal is to not delay it another 6 months, which is what would happen if we missed this opportunity on Tuesday. So that's the other side of the argument, that's all.
Mary Ann?
And we might get there.
Thank you. When Maureen was talking earlier, she said something about knowing that she was preaching to the choir. And I may have been the only person in the audience here who actually has not been a member of the choir. Before I started working on the governor's task force back in September, I had never had any involvement with any criminal justice issues at all. When people started talking about reentry, I didn't know what it was. I've been immersed in this issue for 5 months. Being a member of the task force, I received a considerable education on all sorts of criminal justice issues, reentry particularly. That education has continued today from the previous panels. And I think, as the speaker said this morning, I think this is probably the year for reentry. And it's sad that it took a tragedy in Cheshire to make people focus on an issue that apparently all of you have known about for a long time. But it's gotten the attention of people who have not been members of the choir, so to speak. And as Maureen also said, one of the members of the task force, and it wasn't me, proposed abolishing parole. And as she also said, everybody came to the point where they realized that reentry is a very important issue. The task force made some very good recommendations on the reentry issue. I will not go into them in grand detail, but there were two proposals that Bill Carbone of Court Support Services came forward with. One was a diversionary program for people with psychiatric disabilities. He also has a proposal that the task force adopted dealing with periods of probation, allowing probation officers to go back to file reports with the court and then potentially alter or even terminate the periods of probation. The task force also adopted 2 comprehensive proposals dealing with reentry. One of them designed by Commissioner Lance, which would expand and increase access to programs and treatments both in the institutions and in the communities. We also adopted a proposal dealing with the caseload issue that Bill Carbone mentioned previously, so that there would be more probation officers, more parole officers who could more effectively supervise people because the caseloads would be reduced. We also have a proposal to expand reentry furloughs from 30 days to 60 days so that there is a longer adjustment period for people entering the community on a reentry furlough. And then we also had a very significant reentry proposal from Commissioner Kirk of the Department of Mental Health and Addiction Services. He identified 3 particular populations that he thought were in need of special increased services. Those populations are sex offenders, the people who come out of a correctional institution at the end of their sentence and ordinarily would have no access to services, and then those individuals who have been diverted. And so I think we've got very strong reentry proposals. I think, as the speaker said, this is the year that something is going to happen with reentry. And actually, I want to thank all of you for expanding my education on this subject. Thanks.
Thank you. Senator Looney?
Thank you, Andrew. Next to Bill Dyson, I guess I'm the longest-serving member of the General Assembly here. Bill has been in the Assembly for 32 years, and I've been there for 28 now, 12 in the House and 16 in the Senate. And we've been grappling with these problems for a long time in a variety of ways. And in the discussion of reentry, the issue of reentry is, just as so many other issues are in the state, an issue where we have 2 worlds, suburban and urban. If you look at the 2 cases that came up almost at the same time, the 2 convicted sexual assault offenders, one who was being released to his sister's house in Southbury, and the tremendous upheaval in that community over that placement. At the same time, someone with a similar criminal record was released into New Haven. And we know that in the major cities, people with horrendous records are released every day without much publicity, without much sense of context or community. And yet, in the town of Southbury, there was a complete convulsion over this placement, and someone with a family member. So we need to recognize that reentry is always a challenge, always difficult. We all know that we need to have more treatment facilities, more halfway houses, more places to ease the transition back into society, because people who are released in that context of help and gradual reentry tend to do much better and have a much lower rate of recidivism than those who are, to some extent, released cold turkey. But that is a challenge as well. We know also that location of those facilities is almost as challenging for the state as it is to locate a prison. These are seen as undesirable uses. There's a great deal of community hostility to them. One of the things that makes prison siting possible, obviously, is the fact that there is a significant payment in lieu of taxes program where communities that do host prisons are paid, in effect, a sweetener to accept a prison. And we need to look at accepting the cost of establishing a pilot program for other kinds of facilities as well, those in which treatment is given, halfway houses of one kind or another. There's already a great deal of concern in many municipalities in the state about the large number of facilities that are owned and run by nonprofits and are not on the tax rolls. And so we need to find a way to address that, and I think create something that would be in the nature of a pilot for treatment facilities. But again, that is, as so many other issues are, an issue of money. Also, I think we need to look at some of the implications of what was said in the earlier panel. We had a policy of deinstitutionalizing mentally ill people over the years, and that has been in many ways an enlightened policy, but it has also meant that many people who might previously have been institutionalized are now being managed in the community to one degree of success or another, and sometimes those people do run into trouble with the law, so that our prisons now become the new mental health facilities. And that is a challenge that Commissioner Lance always brings up, and recognizes that that is an ongoing problem and a great deal of difficulty. In addition, in our system, there is throughout, as we know, the whole system, and I do quite a bit of criminal defense work in my practice, as we know there is a great deal of discretion built into the system. There is discretion on the part of prosecutors about what to charge and what kind of disposition to push for, and a great deal of discretion on the part of judges as well. We need to call upon judges and prosecutors to not take a bureaucratic approach to the criminal justice challenge that we have. To not just take the safe position of assuming that somebody should be placed in prison, And just because a statute calls for the possibility of a prison sentence doesn't mean a prosecutor should seek a prison sentence in a given case. We need to have them be willing to take a few more risks. The safe position always is to take the most aggressive stance, because no one can ever come back and later on say that somebody was let out too easily. But what that does is create problems everywhere else in the system. We need leadership on the part of judges who have a tremendous amount of clout if they seek to use it within the system. I'm aware of a case a number of years ago. I represented a client who had lived in her earlier life at Southbury. She had a degree of mental retardation. She also was mentally ill and also was and had alcohol and substance abuse dependency all at the same time. She'd been in and out of treatment facilities and developed a problem where she entered the criminal justice system because she became obsessed with stalking female postal workers on their route and causing all kinds of problems. So we had several pretrials in New Haven. Prosecutors were getting pressure from the Postal Workers Union. The woman should be jailed. Everyone recognized that this was someone who needed to be in treatment but should not be in prison. Department of Mental Retardation said she was not sufficiently retarded to be in their care. DEMAS said she wasn't sufficiently dependent to be in their care. DSS also washed their hands. Luckily, we had an extraordinary judge in New Haven at the time, Judge McMahon, who convened a meeting of representatives from all the state agencies and said, we've got to work out a plan for this woman. She should not be in Niantic. Now, Judge McMahon was just that kind of an extraordinary judge. And I don't think it was only because the defense counsel was a member of the legislature that he went to that particular length. But ultimately, a plan was worked out. The woman finally, for a while, was committed through the probate court, but ultimately there was a medical regimen that was found to be appropriate for her as a condition of probation, and a support system that helped her to stay on that medical regimen, and she avoided being placed in Niantic, which had been sought by so many others. But that was an exercise of judicial leadership that we don't always see. We have too many people at all levels of the system who take a bureaucratic approach rather than a courageous approach. And we need to have not only a sense of doing what the law allows or compels, but also to use judgment and creativity in the system as well. And that's going to be a significant challenge with reentry as it is, as well as everything else. As we know, one criminal justice expert said that we have extraordinary numbers of people in this society who are serving life prison sentences on the installment plan, a few years at a time, in, out, back again for some other reason. And we have to find a way to recognize that, to recognize that almost everyone in the system comes back into society, and to apply a greater degree of acceptance to reentry programs, to put the resources in, and to not engage in the kind of political demagoguery that just says, let's lock people up and throw away the key, because in reality, we know that, in fact, doesn't happen. People do come back into the system, and we have to accept that and plan for that.
Thank you. I'd like to get back to the issue of resources, because I think that's going to be key. If this is going to be the year of reentry, and we're dealing with the resources needed for a prison population and the resources needed for reentry, obviously it seems if we're not willing to spend more than we have, then something's got to give. But one of the reasons why we brought Glenn Martin up here and folks from New York is to talk about their experiences, because I think in New York what they've been able to do is lower the prison population, but at the same time lower the crime rate, and at the same time put money into reentry resources, which has a better long-term impact as well. And so I'd like to ask, what type of policy changes do you attribute to that reduction that would allow for the freeing of resources?
First of all, I'd like to say thank you for the opportunity to speak here today. Usually I'm sort of the odd person out based on all sorts of reasons: skin color, the fact that I'm an advocate for people with criminal records, the fact that I'm formerly incarcerated myself, and today because I'm not even in my own state. And I noticed that my colleague was pretty vague about where the Fortune Society is located. We're actually in New York. But before working at the Fortune Society, I spent about 7 years as the director of the National HIRE Network. And HIRE stands for Helping Individuals Reenter Through Employment. I've done policy work around the country to remove barriers to employment facing people with criminal records. Before I talk about all the things that we're doing in New York in terms of policy change, let me start by saying that there's obviously a long way to go in New York, and by no means am I here to tell Connecticut what it should be doing. We do have the fourth largest prison population in the United States. We have 63,500 people in prison, 69 facilities. We still have the notorious Rockefeller drug laws on the books. Last year, 8,000 of the people who went to prison were parole violators. And we do have a rise in crime upstate New York in some of the rural communities, probably can be attributed to the gentrification in New York City and the rise in property costs and rental costs and so on. And so some of those communities are somewhat ill-equipped to deal with the situation, but our Division of Criminal Justice Services is addressing that issue. Before I jump into New York, I also want to point out that the governor of Massachusetts yesterday passed an executive order to create a Ban the Box initiative on the state level. And I don't know about how many folks have heard of Ban the Box, but this is the first time it's ever been done on the state level, and the idea is that anyone who applies for any job at any state agency, as long as there's no statutory bar, will be found otherwise qualified before the criminal record is taken into account. And that way you isolate when the criminal record is considered, and you're able to identify levels of discrimination based solely on a criminal record. New York. Well, let me say this. When President Bush, during the 2004 State of the Union address, discussed the importance of reentry and addressing barriers that people are facing, barriers to housing, employment, health care, and so on, it made this into somewhat of a nonpartisan issue, especially for New York. And in fact, some of the most progressive reentry policy shifts that we've seen in New York are led by Republicans in our state legislature. There's no silver bullet. I think that legislators and the public in general in New York State have somewhat more of an appetite for risk, if you will. And of course, what happened here in Connecticut is a tragedy, and we have similar occurrences in New York State. But I think folks have been willing to say that we need to take a look at those things and address shortfalls in the system, but also not let that stop us from moving forward on our reentry initiative, since we know that reentry works. Number one, we redefined the goals of sentencing in our sentencing statute. And so now reentry and reintegration is an important goal of sentencing for the judiciary. We've seen a 12% reduction in the prison population. We have 8,000 less people in prison now than we did 8 years ago. I think the most significant thing I would attribute that to is our robust system of alternatives to incarceration. And not just around treatment, but also around employment and around other criminogenic needs, if you will. Housing, health care, and so on. We have a very robust system in New York City and increasingly across New York State. We've been evaluated by the Vera Institute of Justice and other pretty prestigious criminal justice research think tanks. It's been found that for every $10,000 invested in ATI in New York State, there's a $30,000 savings in displaced jail and prison costs, with no reduction in public safety. Our governor, Governor Spitzer, has sent a clear mandate to our criminal justice agencies that he thinks reentry is important. We have a sentencing commission currently in New York State that's going to be issuing guidelines for revisions in our sentencing structure. And one of the major things they're looking at is moving to determinate sentencing across the board. But interestingly enough, the preliminary report, I'd say about a quarter of the report is focused on reentry-related issues and gives reentry policy recommendations. Our governor, about a week ago, announced that he's closing 4 prisons in New York State. We're also closing 6 juvenile facilities in New York State. What we're trying to do now is right-size prisons, if you will. There's no job loss at this point. I think, interestingly enough, the governor also announced a $1 billion package to build up the economy upstate New York, because that's been the biggest pushback for us in New York State. Every time the advocates push for closing a prison, especially now that the prison population is down, I mean, that's what's different about New York than, say, Texas and California. We've always been compared to Texas and California with the number of people we incarcerate, but now we have a reduction in crime and a reduction in the prison population, clearly showing that you can't incarcerate your way to public safety. If you look at some of these other states who continue to incarcerate people, you see that they don't have the reductions that we have in New York. And again, I would attribute that to our robust system of alternative to incarceration. So some of the other things that we've done, so the governor recommended this $1 billion package for upstate economic development and expansion of our SUNY system. What we found is that in communities upstate that have colleges, there's no hard push for building prisons. So there's some other form of economic development in those communities. And so again, simultaneously, our governor talked about an expansion and endowment of our state university system. There were a few reentry bills signed in New York State last year. One is to eliminate the high surcharge on the telephone calls for people in prison to their families. The other thing is youthful offender adjudications, which are not considered criminal convictions in New York, although a person can serve up to 4 years. Essentially, it's when a judge wants to sentence someone to some sort of punishment but not have them stuck with the stigma of a criminal record. It's been determined that employers cannot fairly consider that when considering a person for a job. Our Article 23A, which is our statute that gives guidance to employers on how to consider people with criminal records. So we have guidance on the books. You should look at things like age at the time of the conviction, severity of the conviction, time elapsed since the conviction, evidence rehabilitation. Again, gives clear guidance to private employers, public employers, and licensing agencies on how to consider an applicant with a criminal record. We've actually extended those protections to current employees. We found that after 9/11, a lot of employers who had people currently working for them decided to do background checks and started letting people go based solely on the criminal record. And we felt as though if an applicant has a certain level of protection, then an employee who's been there for a while and shown evidence of doing the right thing and not reoffending should also have the same protection. We've also made it so that Medicaid is suspended for a person in prison as opposed to terminated. So if a person is serving less than a year in a New York State prison, Medicaid is suspended as opposed to terminated. And now we're moving towards facilitating enrollment in public benefits before a person is released. Our New York State Division of Criminal Justice Services hired a reentry coordinator. No better way to institutionalize reentry work than to have one person on staff who's responsible for tracking that work. Our Department of Correction has opened a reentry facility. So there's one specific facility where when people are returning home to a certain region, they get sent to that facility first and start working on reentry related matters. Birth certificates are now free for people leaving New York State prison, whereas before there was a fee involved. There's an MOU between DMV and Department of Correction to help facilitate ID for people leaving prison. Higher education, we have our commissioner of the Department of Correction is a staunch supporter of higher education in the criminal justice system. I would agree with your commissioner who said that there's limited resources for people going to prison. I'd probably attribute the fact that the prison system may only be serving younger folks to the fact that youthful offender grants are for folks under a certain age, and that's the primary resource used to run these higher education programs these days. But our commissioner has diverted funding to expand a couple of programs that still exist in New York State. And as advocates, we continue to push for reinstatement of eligibility for financial aid for people who are in prison. Parole, really quickly, has hired a reentry coordinator. Correction has a reentry coordinator. There's an easing of fraternizing rules in parole. I think parole has realized that what better way to teach a person coming home on parole how to do the right thing than for them to talk to other people on parole who are doing the right thing. Graduated sanctions, we're moving towards graduated sanctions so that we're not just reincarcerating people immediately for small violations. And again, across docs and parole, there's been a strong willingness to work with community-based organizations in partnership. Thank you.
Brian, as the reentry and I guess criminal justice public policy and planning czar for Connecticut, what's your view from 30,000 feet up?
Well, I think, first of all, I want to thank you, Andrew, and the Institute for hosting us here today. Just a real wealth of information from the start to the end. And I think a good way to conclude it today, before we perhaps we'll take some questions, is to talk a little bit about the Criminal Justice Policy and Planning Division within the Office of Policy and Management. It's a relatively new division created in July of 2006. The idea is to provide better data, research, and coordination amongst the state agencies and the other stakeholders in the community for a variety of criminal justice issues, of which reentry is one of them. In our first year, we were tasked with a comprehensive plan to look at reentry in the state of Connecticut. And what we did in our first plan, which was released in April of last year, is really just take an inventory of what we have here in Connecticut. We've heard anecdotally a lot today about some of the programs, some that work, some that probably could be improved. What we provided, however, is over 120-page document that lays out a general philosophy, which the agencies agreed upon, which also identified programs that we have currently for reentry, with a real emphasis on mental health, and also then identified some issues that the agencies need to work on in the coming year. Excuse me, this was introduced last April. And this is available, as is all the reports that our division does, on our website, and that web address is www.ct.gov/OPM/criminal justice. And I would really encourage people, as you leave here today, when you get a chance, take a look at our website, take a look at this report, look at the variety of different programs. As Mary Ann said, this has been a real education for her. When I took over as undersecretary, I was really astounded, and I had been a prosecutor, at the number of programs that were available. Some were small, in fact many are small, started with grant dollars, but I think it's important to take a look at those programs, the communities that those programs are in, and the type of offender that those programs are designed to serve. As I said, we do three particular things in the Criminal Justice Policy and Planning Division. We have an adult unit focusing on these types of issues. Also, domestic violence is a big issue for us. We have our research area, which works collaboratively with Dr. Cox here at Central. Central Connecticut is our statistical analysis center for the state of Connecticut, and we work hand in hand with them in producing these reports. And we also have a juvenile division that focuses on juvenile issues. All of our reports, including a monthly correctional report, are available on our website. And the reentry plan, which contains that inventory, is available there. I won't go through all of it, but what I will do is talk about the issues that we identified last spring for the agencies to work on in the coming year. And many of them are what we talked about here today. The first, improved information sharing amongst the different agencies as well as our non-profit community providers in the communities. And this is something I think cuts across the entire criminal justice system. Talked about barriers to employment, access to housing being a major issue that has been somewhat overlooked until very recently. Difficulty in obtaining state-issued identification, and I think Commissioner Lance touched upon that today. And also victim safety and family reunification. Those were two important issues that the group saw. And two programs in particular I'd point you to is our CORP system, Connecticut Offender Reentry Program, which focuses on individuals with serious psychiatric disabilities with co-occurring substance abuses. And that was started with grant dollars, and what we've done with that, and hopefully we'll see some expansion on that. And also education. Everyone, I think, would agree that's one of the keys to a successful reentry program. We talk about what the Unified School District number 1, which is our DOC educational school district, is doing. Hopefully they're approaching 1,000 GEDs this year. And I think that's something a lot of people don't, higher than, Commissioner Lance is telling me higher than 1,000 GEDs this year, which is really terrific. And I think, not saying we've got all the answers, but we do have some of these ideas that we're trying to put into practice, and that's all outlined in our comprehensive report. The idea that I'm really pleased with here today is that we heard Senator Kissel and Representative Lawler talk about some of the discussions that are going on at the legislature and with the governor, and the fact that we're all agreeing that community supervision and good reentry is good public policy. And we're not debating that issue, we're debating other issues related to how quickly we can get the funding for those programs, I think is a good thing. And I think it's because the data and the research that we're starting to pull together that shows the policymakers that yes, it is good policy because it does reduce crime, and that's important. And I think that in itself speaks well for the state of Connecticut.
Thank you. And before we open it up for questions, I guess I'll do the quick wrap up now and just say that, you know, a lot of things have been mentioned here today, and I know one of the issues that people had in listening or reading the evaluations from the last couple of conferences is where do we go from here? And we have a few folks who've been in the audience we've planted in there that have been taking notes, Christian Woodcock and John Radacey and a few others from the Institute for the Municipal and Regional Policy who are going to help us put together a white paper so that we can move forward and take what was discussed here and hopefully integrate that into public policy recommendations as we move forward. Part of what goes in there would be useful information provided by you through the evaluations that we put on your tables. They're the yellow sheets there, and there's a box when you leave that'll have is a receptacle for those if you want to please share your thoughts with those. And we can take it, so say what you want, and we'd really like to hear what you have to say. So I think that white paper, though, will be entitled, and I've heard it a couple times today, so I think I can safely say it, that this is the year of reentry. So let's hopefully make that the case, and see if we can't take that forward. With that, I'll say, any questions?
Comment. I'm taking my re-entry hat off for right now, and putting on my sensitivity cap. I'm a father, I'm a taxpayer. Okay, I'm a concerned citizen. Throughout New Haven, Hartford, Bridgeport, Waterbury, Norwalk, during the course of the year, combined, well over 300 murders. Okay, but unfortunate, and I really mean unfortunate, incident happened in Cheshire. Okay, and we turned the state upside down with such things, words as horrific. I think when one life is lost, that's horrific. And throughout our state, we've lost many, many lives. And the mental issues, the substance abuse issues, maybe in years to come, those institutions can be separate, just like the gender institutions are separate, because even somebody with a mental illness can hold a job if you put them in the right place. But if you put them in around certain other inmates, then a mental illness turns into a negative strategic plan on how to survive out into the streets. So we have to treat that condition, and if a mental condition is what it is, a mental condition, that brother needs to be in an area that addresses just that. If it's a drug abuse, they need to be in an institution that addresses just that. So then maybe the $50,000 sticker that it takes for one inmate, we can drop that. The tabling of more prisons being built, we can drop that. And then the judge can sentence somebody who has a substance abuse problem, a mental illness problem, not to a prison system, but to a place that can really help him with his condition, with his disease, with his problem.
I think those are extraordinarily valid points and very much right on. But I just also want to sort of throw out there this other notion as well, that I learned an awful lot during the hearing on the over a dozen bills that the Judiciary Committee had. And there was a proposal to have an institution, a standalone institution with a Department of Corrections for folks with mental illness. And the advocates for folks with mental disabilities were very much in opposition to that. And so at the end of the day, and I know that Commissioner Lance is, you know, we have Willard Cebulski, and for nonviolent offenders that has a predominance of folks with mental disabilities or mental issues. We have Garner with a different set. But when folks are released out into society, the concern for advocates was that if you have a standalone facility, then the predisposition of the judge or whoever's sort of in charge of making the decision is going to be violate them, send them back, because there's a standalone facility just for these folks. And they said, ooh, wait, stop. That's the wrong direction. Go and find out what's happening with these individuals. Maybe they violated their probation because they didn't take their meds, or someone's not following up. And so they don't even need a standalone institutional framework to turn it around. They need someone sort of there at the scene, outside in the community, to sort of walk them through and to make sure. And you hear stories about, and again, Commissioner, you know, they release them with 2 weeks of meds, and they're not, and whatever the other provider's going to give them meds won't pick it up until 6 weeks, so there's this 4 weeks, and if they're not on their meds or this or that, and so folks fall through the cracks and they end up getting violated. And so I think the best approach from the advocate's point of view, while we do have this institutional issue, and I clearly agree, and by the way, Bill Dyson does deserve so much commendation for just plowing through on these issues for years and years and years and years and years. And we did such a great disservice when we deinstitutionalized folks with mental disabilities, because we said, we're going to take them out of the big places, we're going to create other smaller places and other in the community. And we did the first part, we just never did the second part. But now that we're sort of at this in-between period where we can make certain decisions, I'd rather see the emphasis, assuming that we can rally the resources, into the communities rather than making it maybe more easy to just violate folks because there's a standalone institution. But I just throw that out there as just as a sort of along the lines of exactly what you're thinking. But I think that you raise incredibly good points with that.
Excuse me 1 second, and in meeting, because I was locked up with.
You need the mic because we're on TV.
I was supposedly locked up with a number of supposedly mental illness men, okay? And all they needed was a job, okay? Now, what mechanisms are in place that puts that stigma on them of having a mental illness? See, and that's my thing too. Resources are needed because, like I said, there's young men, there's men out there who are seriously diagnosed with, I mean seriously, not institution coming into the penitentiary mental illness, but with serious mental illness problems and defects. They hold employment. And employment is such a key to the success of a man, you know, to be able to be a provider, where if you give them the opportunity, that mental illness stigma that's been off them, okay, that's the medication that they need, not the Thorazine. A man needs to be able to have pride, be a provider, and be independent. So let's do what we need to do as far as trying to come up with some serious strategies on employment and the other piece of reentry, getting these men to be in groups of other men who've made it.
Mr. Jackson, he stole my thunder, but I'm glad he did because I had the exact, well, not exact, but pretty similar thought to what he was thinking. I got to be blunt and say that I was disturbed listening to Mr. Farr and Representative Lawler and Senator Kissel, because when you were talking about the public safety situation, you referred to a failure, singular, that occurred last year. And he just ran down the numbers of individuals that are dying in, the urban cities. So that makes me wonder that when you're talking about public safety, is public safety for who?
Sure. Can I just comment on that? Prior to Cheshire, we had begun a program for parole where every time somebody got arrested for a new criminal offense, we were going out and trying to do an analysis to see what went wrong. Was it the lack of jobs? Was it the drug use? To try to determine and identify what that failure was. So Cheshire was a high-profile failure, but we considered every criminal offense to be a failure, and that occurred prior to Cheshire. And I think everybody here absolutely agrees with you that a victim is a victim, and it doesn't matter where that victim lives or the color of the skin of that victim. Everyone has a right to have the same protection, public safety protection that everybody else in the state has. And
okay, respectfully then, if that's the case, then don't you think you should be referring to the public safety failures that are occurring on a daily basis in Hartford, New Haven, Bridgeport, other urban?
Yes, I agree with you.
Instead of saying, let's
no.
not have another Cheshire.
Right.
Let's not have another
right.
Let's not have another New Haven.
I absolutely agree with you. It's unacceptable. It should be unacceptable to all of us when there are 33 murders in the city of Hartford. And, this should be simply unacceptable to all of us, and I think it is. And I think everyone here is working on it. The reality is Cheshire got more press attention, so there's more of we have to do more explaining on Cheshire. but we should be explaining why any of those crimes occurred and why we weren't able to give our citizens better protection.
And I'll make my second question. We've got people waiting behind me. Representative Lawler, you said at the top of the workshop that you acknowledge the need for alternative incarceration programs. So I'm wondering then why are you co-signing a bill that calls for the building of another prison?
What we're trying to stress to people is that we have some very difficult choices we have to make. And the do-nothing option is not an option. Given the current prison population, we either have to get that number down or build more prisons. And my colleagues need to make a choice. If you're asking me what my choice is to get the prison population back down to where it should be, which is where it was for 4 or 5 years, pretty constant, about 17,000. Right now it's 19,750. I think there's a lot of reasons why that's happening, and I think that the very things we're discussing at this meeting can get us back to where we should be. The last prison, well, we opened a few smaller additions recently, but the last real large-scale prison construction in the state ended in 1995, and I think when that was over, most people felt that we had enough capacity. The year I was elected, 1986, we had 6,000 people in prison in this state. Now there's 19,750, and I think no matter how you look at it, you'd have a hard time arguing Connecticut is soft on crime, right? So it seems like we've done enough of that. But if we don't do what we're talking about here today, which is establish a much broader network of reentry and diversion options, in other words, give police and prosecutors and judges more options than simply incarceration, then we will need to build a prison. So that's the choice we have right now. Do we either want to fund these reentry options or these diversion options and these mental health options and these drug treatment options, or build a prison? And I think many of my colleagues don't realize that that's a choice we are making right now. I think many of my colleagues in both parties would just assume ignore the reality of that choice. And so by putting that in legislation, we gave people that choice. Here's the choice you need to make. You can delay it for another month, you can delay it for another year, but sooner or later you're going to make this choice, or a federal judge is going to make it for us, which is what's happening right now in California. And so I hope we never have to build another facility. That's my hope. But if we're going to have what was projected, you heard it this morning, Steve Cox said that in 4 years, if current trends continue, we'll have 25, 26, 27,000 inmates. Well, that's 6,000, 7,000 more than we have now. That's 6, 7 more prison facilities. So if that's the road people want to go on, they should know right now how much they're going to have to pay, and that we're going to have to site these 6 or 7 new prisons. So people need to know the reality. And I think politicians in both parties are very good at ignoring the reality sometimes, but we've gotten beyond that point. We have to confront the real choices here. And I hope the choice we make on Tuesday is the choice to go down the diversion and reentry road for the nonviolent offenders, so that we'll have enough prison cells already for the truly violent offenders. That's the goal. That's what we're doing.
Can I just throw in for very briefly too? Aside from all the other laudable goals that, folks up in my prisons, I don't want them to come back. I want them to turn their lives around because it's for them, it's for their children, get a job, everything that this gentleman said right here, the pride, the dignity. There's a whole nother issue that's sort of specific to Connecticut. And again, when I first spoke, I talked about the early childhood. If you look at Connecticut and its population trends, we have an aging state, and our birth rate compared to other states is level or going down. We cannot economically afford to lose anybody to a life of crime. That's why, even though I have 7 prisons and I say we are not going to build our way out of this, we have done our fair share in North Central Connecticut, and bricks and mortar are not going to solve this issue. Above and beyond that, because I think it's good policy, better use of dollars, the viability of the state of Connecticut is dependent upon not losing individuals to a life of crime. We need to have redemption to survive in the global economy. There's a lot more things going on here than just crime and punishment. It's the viability of the state 10 and 20 years from now.
I think we'll just take 2 more questions here because we have to wrap it up. Thank you.
I've heard a representing your communities, representing the state, educating the communities. I mean, can you put the statistics out there in terms of what individual programs in the communities are doing, what's working, why these programs are needed? I know the Cheshire incident certainly did not help the situation. So there's, a viable argument there, but I think it's really important that the communities, they're fearful, of having ex-offenders come back into their communities. So if they're educated as to how these types of programs, supportive programs can be helpful, and have those communities back them, I think it will be positive, all around.
I think you addressed a really important reality in the state. Mark?
Just in response to that, I think that is crucial. We need broad-based community support for anything that we undertake. Otherwise, it will lose momentum very quickly, and people become defensive. One of the realities that we have to recognize, and it came up in the statistic mentioned earlier about 1,000 people a year getting GEDs within the prison system. Well, that's a good thing for those 1,000 people, but it also points out the typical profile of someone going into prison is someone who does not have a high school education. Someone who is, even if he does have a high school diploma, may not have the skills that we believe are commensurate with that level of education. So that many of the people going into the system are people who have not been gainfully employed up to that point, who are not prepared for employment. So, and that went on through the first 18 or 20 years of their lives. And now we're saying someone who goes to prison for 3 or 4 years, that in addition to being punished in prison, that he is supposed to now learn in those 3 or 4 years the skills and be prepared for society in a way that he was not in the first 20 years of his life. And that is a tremendous burden that we're putting on the system and also on the reentry program. So we have to look back even at an earlier stage. We keep hearkening back to education expenditures in our society. And this is another example of why that is crucial, why it is an investment, why we have the problems that we have, is that many of the people in the system are people who are unable to function in terms of our increasingly sophisticated society. The kinds of jobs that are available are generally those that require a higher level of skill and education, and yet we see more and more people passing through the system to one degree or another, winding up in prison without that, coming out again with the additional burden now of being labeled as an ex-convict on top of the lack of preparation that they had going in. So these are our challenges.
And also, I'd like to address that the university systems could play a pretty crucial role in that, and we're hoping to do that at the Institute and at CCSU. And that's one of the reasons in the impetus for the next program that we're doing, getting the arts community involved so that everybody can recognize that everybody's involved in the solution to this. It's not just the criminal justice community. And in order to allow folks to realize that, they have to become aware of what the situation is. And I think these types of forums brought out to different types of stakeholders are key, are one part of that solution that she mentioned.
I just have a quick follow-up. I'm Sally Shank, President of the Board of Family Reentry. It really follows up on your comments just now and the 3 former speakers here, is a suggestion to actively include the media in forums such as this, because I think we are all, the public, the Department of Correction, nonprofits, at the mercy of the way the media covers this topic and the terrible stories such as Cheshire and everything else to do with this topic. I know I have attended roundtables at John Jay in New York, specifically designed to educate the media, bring them up to date, keep them well informed, and they induce, and the technique that works there for them is they offer prizes for the most balanced and appropriate coverage of topics on the subject, and I think that's another good vehicle that we might include in this kind of a forum in the future. Good suggestion.
Sally, if I could just have one comment on that. You know, this criticism of the mainstream media, these sound bites, you watch the local news, you see the accidents and the fires and the murders and stuff like that. But the great news, and I think all of us in the legislature have learned this recently, is that there are many citizens in our state that watch the coverage that is being provided here on CTN. And I'm amazed how many people will sit and watch we had a marathon public hearing a few weeks ago at the Capitol and went until 2 in the morning, and people watched it in many cases from start to finish. And I'm quite confident that when CTN broadcasts the entirety of this forum today, that many of our fellow citizens like us will have learned a lot from these discussions. And I think even though Mark Davis from Channel 8 is not here, you know, even if he were here, he'd show a 2-minute summary of this. But many people will be able to see all of these speakers today, and I think they'll be fascinated, like all of us are, to learn this and realize that these decisions are much more complex than they thought they were. And I think the more that's why I give great credit to CCSU and Andrew Clark for putting this together, because this, to some extent, we are preaching to the choir here, right? We all work in the system. We all know how it works, but we do learn from each other even here. But the people who have ordinary jobs and watch this will learn a lot, and I think this will contribute to it. So I'm actually kind of hopeful that the message is going to get out.
Conversations, the public is often more willing to entertain a more complex view and understanding of this issue than is presumed. And I think that gives me faith as well. People do understand these are complex issues that need complex solutions, and they do work.
Quinnipiac University recently did a poll on many of these issues, and I think that we were all surprised by the responses we got, that people have a much more nuanced view of this stuff than you might think. And I think a lot of that has to do with all these public discussions. So we're all learning together, and hopefully will result with a good outcome.
In many ways, media is the third branch of the checks and balances in this country, and we need to keep them educated as well.
Maybe the first branch, I don't know.
Yeah, and I'd like to echo Mike's sentiments, and that's certainly been the case. I have yet to break down to get cable, but I have friends.
Come on.
I got a cell phone a little while ago, but I like to have long conversations, I guess. But I have found that a number of my friends that do watch the CTN network, and be them electricians or landscapers or whoever. I mean, it happened to me too. I wasn't involved in government. I wasn't involved in policy. I was stripping roofs before I came to work with Bill Dyson, and I found that getting involved in it and really being invigorated in the process was an invigorating process. I mean, it's really amazing what can happen when you can take your experiences and bring them and see tangible results within a state government, and in somewhere where you didn't think you'd be able to have an opportunity to create any type of change. So I certainly I thank Sally for that segue into the end, and Mike and all the panelists here, all the time and effort that has been put in by folks at CCSU.
Can't take those last two people.
Oh, the last two questions? Sure. Okay. If people want to stick around.
You can make it. You have made a difference.
Two questions. First is, there's a lot of success stories here, but there's lots and lots of people out there who have fallen through the very wide cracks of reentry support. To ban the box is something that many have talked about. Checking off that box is really a death knell to them. Would you support representatives and senator legislation this year to ban the box?
Well, this is the first I've heard of that specific proposal, and I don't know what it actually means, so I'd like to understand a little better.
What it means is that on employment applications where it says, are you a convict? And if you are, you check it. And if you are and you don't check it, and they find out, sooner or later you get fired.
Yeah, but.
So that is off the application.
Then I'll talk to.
I think we could probably have a conversation
Yeah.
with Glenn about that, because I know he has a lot of information on the particular aspects of it and how discrimination ties into the box, and I certainly would like to follow up with that as well.
I'll
So.
follow up with you and with Glenn and make sure that the representatives here get some information, because we'd like to see that come to the table this year.
Maybe.
Secondly, we've had.
Maybe we could have an informational hearing in the Judiciary Committee on that, and so we all of us can learn about that more.
Yeah, we'll get you some information ahead of time. Secondly,
It's up to the chairman.
there's been a lot of talk about discretion and nuances and what the public wants. In fact, when the public was polled about 3 strikes versus reentry, as Representative Lawyer said, he was surprised that people understood the nuances when they came out and said, yes, we want better reentry. As I understand it, on Tuesday, there's a big issue of the day is a more restrictive 3 strikes. We already have one, up to judge's discretion. My understanding is it is to take away judge's discretion, which seems to me in contradiction of this entire day. Are you going to be supporting a 3 strikes that will take away judge's discretion?
Okay, As one of the primary advocates of the narrowly tailored three strikes proposal, that's one of the things that's being debated amongst the leaders of the various legislative caucuses and the executive branch. When Governor Rell came out with her package of proposals, which was widely lauded by legislative leaders from both Democratic and Republican parties, she had a variation on three strikes. On the three strikes, and by the way, with our persistent felony offender laws, I mean, the judge or the trier of fact can impose additional penalties that can be quite severe. If you get a 25-year underlying sentence, you might get another 25 years, effectively 50 years to serve. And so you sort of hear different criticisms. The three strikes that's narrowly tailored is too weak, it's not going to do anything, or it's too draconian and it's too overboard. We have, those folks of us, those of us that champion that proposal, put a lot of time and effort into making it very narrow, not as wide as California, narrowly tailored to specific sets of crimes, and the safety valve, the latitude, is that it is discretionary on behalf of the state's attorney as to whether they want to pursue that. And we did have testimony, even before Governor Rell had her variation, that from Chief State's Attorney Kevin Kane, that it would be indeed another arrow in the quiver of crimes that could be asserted, and that in certain numbers of cases it could be an effective tool to either elicit a plea bargain agreement from an offender or to at least exact justice in some specific horrific cases. So I would suggest that while I understand the concerns raised by folks regarding the implications of the three strikes proposal, and I understand the Quinnipiac poll, a lot of time and effort and negotiations and thought have gone into the proposal. It's still up in the air as to whether it will garner enough support to be on the table for a vote on Tuesday. But certainly I think that the folks that are championing it have been sensitive to the concerns raised by folks that are concerned with it. And again, there's other elements of the compromise proposal that everybody's in agreement with that in probably more instances would end up in a longer incarceration period for various individuals. That being said, I don't think that that necessarily controverts efforts to allow for reentry. My position, and I think the majority of my colleagues in the legislature, but of course I can't speak for them, but I believe that we can do a much better job reintegrating individuals that want to turn their lives around, that want to pursue redemption, that want to go ahead and be lawful tax-abiding citizens. There's so much we can do there that if we start today and start the funding today, 10 years from now, we will still have things that we can do. At the same time, whether in response to a horrific tragedy like Cheshire or to the day-to-day violence that none of us in this state can tolerate, whether it's in our urban communities or whether it's a child that's delivering papers in a suburban community one day and then she's gone the next, and no one ever knows what happens. There are crimes that are just unacceptable. And if we find the perpetrators of those crimes, I think that there is a will on behalf and desire for the vast majority of the public that we need to get very tough with those individuals. But I don't think that they're mutually exclusive. We're trying to form the balance. Some of us may lean more in one direction, others lean in the other direction, but I commend Brian because he said most of the basics we're all in agreement on. And so don't lose heart that because some of us want to get maybe a tad tougher for a certain coterie of individuals that everything else is lost. That's not the conversation that's taking place at all.
Thank you. One more, Jackie.
First of all, I have a question. I heard, as you were talking about the governor's task force, a few of you said that you were schooled here today, more or less. So my question is, when you put together the governor's task force, we talked about community participation and trying to make ways to address reentry. Do you have anybody on your task force who have gone through the process, who could contribute to it in your conversations, number one? And number two, my program, the Connecticut Party Team, works with people who you just described, who are trying to move back into society, but too far. What I found is our participants who have gone through the pardon process and received a certificate, when they go to apply for a job after the state agency of board and pardons parole says, you are clear to say you have never been convicted of a crime, and they go out and try to get employment, that background agency comes up with information that's old. Now, I do know that there was some legislation that goes into effect in February. My question is, will that make the background agencies who come up with this information that's not up to date accountable to those who have gone through the process through a state agency to clear their record who are looking for employment?
Yeah, let me just comment that you have a very valid concern in this area. We're aware of the fact that there are people who get a pardon and then 5 or 6 years later, they go to get a job, apply for a job, and are told that the background check shows they're convicted of a crime. Senator Looney has put in that the bill you talked about in terms of requiring the agents, the companies that are selling those background checks to keep it up to date. There's been negotiations going on in the last week or so, and my understanding is there will be another bill this session. Is that right? Senator Looney can comment on that.
Yes, that's
that
right.
will cure.
Working on that issue in terms of the sources who gather information for employment background checks, and having greater accountability and making sure that there is a more timely information about the fact of pardons being granted, so as not to undermine the effect of the pardon. There was some concern about some of those commercial reporting entities about how often would they have to buy new lists, how often would the practical difficulties of keeping up with the pardon process. The pardon board only meets 3 or 4 times a year, so it would seem to us that some system that involves quarterly updates would be reasonable. And I think that that's what we've been talking about. There have been a few meetings in terms of representatives of the legislature, the judicial department, and some of the information gathering services to try to work out a workable system.
Does that include the list that is accompanied with the Board of Pardons? So if I call up the Board of Pardons and Parole for an application, my name and my address goes on the list. If there is a starving lawyer out there who needs work, to my understanding, he can come to your agency and get the list of all the people who've called for an application.
My understanding is that we have cured that problem internally. We do not keep a list of people who've applied, so that if you call and ask for an application, it would be sent out. An envelope would be made out. There would be no list kept. So therefore, with recent inquiries to get that list, we don't have that list. We don't keep a list of people who've asked for applications.
Oh, thank you.
Just for full disclosure, one aspect of the bill that we'll probably do on Tuesday postpones the effective date of that law about background checks by, I think, 3 or 4 months, to give the legislature the opportunity to make this change that they're discussing has been negotiated. Because the effective date, I think, is February 1st. Is that right? And that's obviously before the new session begins, and the business community and the people who represent the folks who do these background checks have said that if there's a few adjustments made, then it's going to work perfectly, and I think that's the negotiation they were referring to. So we're going to postpone the effective date to give the legislature the opportunity to make those changes, and once those changes are made, then from that point forward, they'll be able to comply with the obligations of the law. And I just want to add one other thing. Apart from the formal background check, and I know this because where I work, our former students, my students, it turns out that, you know, aside from having the court records of what happened, there's also the newspaper records of the arrests, and a simple Google search will pick up all those newspaper articles, and I think that's one of the real dilemmas now, and that is we can grant a pardon and erase all the official records, but the Google search will still pick up the newspaper article about the actual arrest or the police blotter, and that's something that will always be out there. So I think we're going to have to change attitudes about people who have had involvement with the criminal justice system. As much as we are cleaning their official record, we have to also change attitudes about the significance of this. And I think one of the benefits of this information revolution is, since there's so much available about you, me, and everybody else, right? I think once we find out everybody's whole story, which we probably will be able to do pretty soon, we'll find out that pretty much everybody's got something in there that would probably be a little bit embarrassing if it were known publicly, and that's the downside of it, but there's also an upside. I think people are just going to be a little bit more mature about the significance of these mistakes that people make when they're younger, you know.
That's understandable. I'm sorry to hear that you're postponing that for another 4 months, because we've had people who have gone through the pardon process who are trying to move forward, and to have that thrown in your face is just, again, another barrier to stop them from moving forward. So as far as dealing with that, that is, I think, just something that the legislators have to look at, because it's going to be difficult to move forward if we continue to have barriers that stop us from doing so, and it's going to take a mindset. As I tell the participants that work for me, or that come to me, you know, they go and get their record from Middletown, and then they get their record from the police department. If they put that in their package, they might have got arrested for a larceny first, and gone down to court and got it knocked down to a larceny 6. If I'm looking at their record, and I see both, or I see larceny first the first time, and larceny 6 the second time, the larceny first is going to stick in my head. So I think you need to look at that. I mean, because like it's another barrier, and it's frustrating. So
Can I add something to this, please? Even right now, without having a bill in Connecticut, you do have the Federal Fair Credit Reporting Act, which gives clear guidance on accuracy around commercial background check companies. And background check companies that provide criminal background checks do fall under the Fair Credit Reporting Act. I was at a presentation at the American Bar Association in D.C. last weekend, and it was an entire conference just on commercial background check companies and how they're handling background checks and this similar situation. And it was well attended by Choice Point, Axiom, and a lot of the major commercial background check companies who, you know, profess to be in the business of providing accurate information. At the Legal Action Center in New York, a legal advocacy nonprofit, and I don't always advocate litigation as the way to go, but they did sue some of these commercial background check companies and the employers who relied on the information. And while the case never made it to court, there were some significant settlements outside of court for the job seekers, upwards of $100,000. So if there are legal advocates here in the state that might want to take a look at that to help them, or there's also the National Association of Professional Background Screeners, which is a professional association of commercial background check companies with about 500 members. So you might want to engage them around this issue also.
Thanks. And thank you, and thank everybody for coming and sharing your thoughts, and hopefully we can move this agenda forward as we go into the legislative session and beyond. And don't forget about the evaluations.